And good morning. Welcome to the Board of County Commissioners Agenda Setting and Work Session for April the 7th, 2020. I'll give some, we'll go through the introductions first. I'm John Hutchings, the chair of the board, and this is?
Hi, Menser. Gary Edwards.
Ramiro Chavez.
Brian Dominique, Public Information Officer for the board.
Amy Davis.
Amy Davis, thank you for being here. Bear with us as we're surfing the edge of chaos. If you would like to be, if you don't have internet, would like to sign in, you can call 360-252-9020. Again, you can call in and conference. You can just listen to the conversation and listen to the agenda setting and work session by dialing 360-252-9020, and your PIN is 1234. So with that, we're going to start with a COVID-19 update. And is it going to be Shelley or Kurt?
Commissioners, it will be both. It will be Shelley and Kurt who will provide an update. And just for the viewing public, we have a Zoom meeting up and running for staff to join remotely, because we're going to start making an attempt not to have too many people in this room. And I think at some point we'll have the conversation as to how this board can still conduct business yet remotely, but there will be a conversation later in this agenda.
Okay.
So with that in mind, are you ready, Kurt? It's Shelley there?
It's Shelley, and yes, I'm ready. Can you hear me?
Yeah.
Has left the conference.
Can you hear me?
Yes, we can hear you.
Radinka.
You can hear me?
Yes, we can hear you. Go ahead. We can hear you before too.
Okay, good morning, Commissioner. This is Shelley Slaughter, Director of Thurston County Public Health and Social Services and Administrator of the Board of Health. I'll start as usual by giving you a situation report and then share some things that we've been working on this week. So statewide, as of the latest report available, which was as of this morning, 7,984 cases in Washington State and 338 deaths. In Thurston County, we have 72 confirmed positive cases and 1 death, unfortunately, that we had this last Saturday. This death was a man in his 80s, and we did just learn that he did have underlying health conditions. Other information just to share with you, at this point in Thurston County, every single city, town, commissioner's district in Thurston County has confirmed cases. So we have widespread cases of COVID-19 in Thurston County. We want to remind everyone of the importance to be diligent about continuing to stay at home and adhere to social distancing whenever you're not able to stay at home. Other things that we have been working on this week include coordinating with our hospitals and healthcare systems on surge planning, as well as with our state partners. We've also been working very closely with emergency management on PPE distribution and allocation. And I just want to give a really special thanks to Director Harden, who's sitting here next to me, for his staff coming in over the weekend to help to facilitate some emergency PPE that we needed. We also have been working in partnership with the team here on finalizing isolation and quarantine sites. And as we shared with you last week, we are ready to operationalize that immediately if needed, continuing to just put some final touches on details this week. This week also, you may have all heard, and I know earlier before you started this meeting, you were discussing cloth masking. The Center for Disease Control and Washington State Department of Health updated their guidance on the public wearing cloth masks when social distancing is not possible. And Dr. Yu would just like to convey to everyone that wearing cloth masks protects others from spreading droplets, but social distancing is still required. And we ask that anyone that chooses to wear a cloth mask continue to do all of the things that we've been recommending in public health to stop the spread of COVID-19. And that includes the social distancing, staying at home, hand washing, covering of coughs and sneezes, sanitizing of surfaces. Do you have any questions for me?
Yes.
Right.
On the pre-existing medical conditions of your folks that you're keeping track of, how many of the individuals that we're dealing with had pre-existing medical conditions?
I'm sorry, Commissioner, can you please repeat that? I just couldn't hear you for a moment.
How many of the people that have contracted this virus, how many of them had or have medical conditions that are pre-existing?
I don't have that information available to me right now.
Is there any reason you can't get that information?
We have that, our investigators do ask questions about that, but that's not information that we share with the public.
Well, I don't know that you need to share it with the public, but I believe the Board of Health should be advised of some of these things. I don't know how we can make decisions if we don't get all of the information that we might need. And there's conditions, apparently, weight is a factor, pre-diabetic, diabetic, age. I think those are all issues that the board needs to be aware of so that we, in the future, we don't even know what we're up against yet. We might have another spike. I would like to have the general area in the county where these people live. I'm not asking for names or addresses. I want to know where these folks are at. So I'll just give you an example. If we've got a group that seems to be experiencing more sickness or virus infection, and they're in a particular area, and maybe that area has a tavern that's not closing down or something, and we can kind of pay attention to those areas. So this business about not giving the board adequate information, I think, is a mistake.
I want to be sure, hang on, Shelley. I want to be sure, you're asking not what the pre-existing conditions are, you want to know about where they live?
Well, several things. I think the board should be aware, are these people the age group that they're in? Do they have pre-existing conditions?
Wait, right there. You're asking, we should get that information. We're getting that information.
No, we're not.
Not
that I'm aware of.
Ages are reported every case in the Olympian, the age is given.
Right, and you're reporting, Shelley, you're reporting the age of the individual and then, and that they had underlying. Do you want to know specifically what their underlying condition was?
No, I would just like to know, because at some point, the public is getting antsy about this whole thing. I would like to make sure that the public knows what the conditions are and where you have the highest risk. I'm not going to encourage people to violate any of the social distancing issues.
No.
I want to have the information because we don't know what information we're going to need somewhere down the road. And that's my concern. I don't care that we broadcast that information, but I think the Board of Health, as the decision makers on this issue, need to have all the information that we can have when we make policy decisions, not just the information that staff thinks we should have.
Well, I get that, but what I'm hearing though is you want two different, let me finish.
Okay.
To make sure it makes sense to me.
Okay.
Number one, you want to know the people that have it, or that have died.
I don't want their name. I don't want their
I
name.
understand that. You want to know if they had underlying conditions, period, or what those conditions were.
Well, especially if people died.
Which one? You want to know
Both.
what their conditions were, okay?
Both. I think we should keep track of that information.
So I thought we were getting that from the regular media and from you, that they have pre-existing conditions, whether it be diabetes, whatever their hypertension, whatever their issues were. I thought we were getting that. And Shelley, you're saying we're not getting that and you won't provide that or can't?
No, sir. What I was saying is, just to back up a little bit on COVID-19. Anyone can get COVID-19, and there is no safe place in Thurston County. Transmission is broad in Thurston County, as it is throughout Washington State. Anyone can get COVID-19. However, people with underlying health conditions and people over age 60, we know, are at higher risk of developing complications from COVID-19, which can lead to hospitalization and death. So I assure you that our public health investigators are working hard around the clock 7 days a week, and they do very careful investigation of all the cases, and to include identifying close contacts and looking at areas where there might be public health significant areas of public health significance and risk.
Okay,
so
Shelley?
that might be a place such as a long-term care facility.
Shelley?
In which case, if we had an outbreak of that nature, we would share that.
Shelley?
However, yes.
Shelley,
Commissioner
stick to the question, please. Are we getting, someone's been infected or someone died, are we getting information as to what underlying conditions there were, yes or no?
Yes, we get that information.
Okay,
We do
and
not
is there-
share that. We
No,
do not
the answer is
share
yes.
protected health information of individuals who and their underlying conditions.
And we're not
When there's a
asking,
death, when we have that, we share that. And over the weekend when the death occurred, we didn't have that information yet, but I did learn this morning that the person who passed away did have underlying health conditions.
okay, so we can, the answer is yes or no, we can get that information. That's not compromising anybody. It's letting the public know someone had heart disease or they had something else with an underlying condition. We cannot say, we can't tell anybody that, or are we, can we?
No, we can't share individual health information with the public.
Can you tell us
So
what?
I cannot share if a case that we had, a confirmed case that we had, what conditions they had with anyone.
Yeah,
Even I do not get that information as director.
Shelley, can you walk us through as to why that medical information is protected and what law regulates that?
Yeah, especially if we don't know who the person is or where they live. Which doesn't violate HIPAA.
Yes, so that would be federal HIPAA laws as well as Washington state privacy laws. So we abide by those laws to protect people's personal health information.
But we don't know who they
We
are.
don't share that information with the general public.
But we don't know who they are. I don't know how that compromises some individual that's completely anonymous to the public. I just don't understand that.
Well, I want to challenge that. If we need to get a legal opinion on it, I do not believe that's a HIPAA violation because we are not asking for specific location or the person's name. I think that is a bureaucratic BS answer that we can't have that information as the Board of Health. And we're expected to make decisions for this community. I'm not buying that.
So we have, and we have legal on the conference call or on the Skype. They can go ahead and look that up and give us some information eventually. But the second part of your question, Commissioner, is you want to know the general area they live in the county?
Well, let me just use an example.
I understand why.
That's right. As a lawman, we made hotspot maps. So when we knew that there were a lot of burglaries in a particular area, we paid attention to that area. I think it is asinine that we cannot have a map with some dots on it, generalized, not the location exact, not the address. So we can be informed about what is going on in our community So when we get asked, we can say something besides, well, I don't know. We can't tell that because that's protected. That's a stupid answer.
Like stay out of the elm or something.
Yeah, well, we might have to say that at some point. We don't know that yet.
Okay. So you say there's no, Shelley, this is for you, there's no place in Thurston County, city, town that's not affected by this, but you don't give, we don't get that information as to whether the concentration or clusters are? I would imagine it would be in the urban area, but that's just a guess.
Well, I will say that, yes, as, where there are more concentrations of people, there tend to be more cases.
Is now joining the conference.
Right, but we're not getting, okay, I understand the generalization, but we don't get information as the majority are in this city, followed by this city, followed by that town, or whatever. We don't get that?
That's right, no.
And is that?
That does not, that information does not make a difference regarding what our public health recommendations will be. There is not an area where sorry, we're having some technical difficulties over here.
Yeah.
Has left the conference.
Oh.
Okay. Can you hear me?
Yes?
Okay, my apologies. We were having some audio issues here. So, if
Well, why can't we get information as to where, in the county, the highest concentrations are?
because there are cases throughout Thurston County, and that does not change what our public health recommendations will be.
Right?
Any place, we don't know where everybody gets COVID-19. I mean, any place in the public where people aren't social distancing, regardless of where they live in Thurston County, they can get COVID-19.
I understand.
So it does not give us information that would change our public health recommendation or approach in any way.
No one's asking you to do that, and everybody is susceptible, but we don't understand why we can't get the general location in the county where the highest occurrences of COVID-19 infection are. That's not compromising individual people. I want to know why, now I'm with the commissioner, why we can't get that concentration type information. It doesn't compromise your guidelines at all. Go ahead, Romero.
I just got an email from Elizabeth. She's listening, and she's going to be looking as to what are the restrictions, how much information can be shared with the Board of Health. She's going to be looking into that.
I just want to make a point. I asked this question last week.
Yep.
So that we could get some information here. I'm not playing checkers. This is a very serious issue we're dealing with. And we don't know what's coming down the pipe. There could be a relapse situation if we release this too early. We don't know what's coming. I think we ought to always plan for the worst case scenario and hope for the best. And that's exactly what I'm proposing. So we have this information. Anytime we have information, we have knowledge. So I'm not buying this. This is the bureaucratic delay process of what takes place with government.
So we'll get more information from Elizabeth.
Well, I'm not too enthused about waiting. I'm disappointed we can't get this information.
Commissioner Benson.
Different topic. I know we've revised the, guidelines regarding masking and non-surgical caliber masking. Has that been, I don't know if I'm asking this question to you.
Yeah,
Well, put it out there. Has that guidance extended to our employees? And I'm thinking of the jail personnel in particular who were under a different directive a couple of weeks ago. And I heard secondhand there was some concern. And now the guidance has changed. I'm assuming our directive to our own employees has changed as well, but I'd like confirmation of that.
Yeah, Shelley, can you describe the process of Tier 1, Tier 2, as to when we provide, N95 masks as well as surgical masks? Who is included in Tier 1, who is included in Tier 2? and perhaps overarching the guidance from the health officer about wearing cloth masks?
Sure, we're going to answer that question in two parts. I'm going to let Director Harden answer the question about PP allocation and tiers, and then I can answer your question about health officer guidance around cloth masking.
And just before you jump in, Kurt, I understand the priority for our supplies, not that you can't recap that, but I'm also then asking, beyond those supplies, what is our guidance for folks in terms of bringing in voluntarily these homemade masks that are kind of circulating through the community right now, et cetera?
Yes, sir. So Kurt Harden, Director of Emergency Services. So real quick, let me recap for personnel, law enforcement, healthcare workers, and first responders, medical first responders. I just want to recap really quick where we are in the tiered process, and then I'll answer the question regarding those that don't fall into that tiered process. First of all, we are still have an extreme shortage of masks, both surgical and N95 masks. And what we're trying to do is, in the Tier 1 system, are masks for healthcare workers where there are suspected or confirmed COVID cases, and EMS personnel where there's suspected or confirmed COVID cases. At the same time, in Tier 2, we have law enforcement falls into that category of Tier 2 as other first responders. What we've been able to do in Thurston County is provide sufficient surgical masks for law enforcement, all the road deputies, all the road police officers, those who are actually out there patrolling, and the jail personnel to have masks, gloves, appropriate PPE for those personnel. The law enforcement now has gone to and this is my understanding, a burn rate of 1 set per day. But we are standing by to replace that. We are also asking law enforcement and EMS to do a mitigation process and a conservation process where they take the masks and they look to reuse those masks if they haven't been contaminated with any kind of contact with suspects, inmates, etc. So having said that, that's where we are here inside of Thurston County. What the CDC changed over the weekend is not a recommendation, but as far as requirement, but they've started talking about public using cloth masks, fabric masks. What that does is that does not prevent anybody from getting COVID-19. What that does is it prevents somebody who may be sneezing, coughing, etc. Those droplets are captured inside of that fabric mask, but it doesn't prevent them from those droplets from escaping. What it does is it prevents those droplets. It captures those droplets, but it doesn't reduce the infection possibility to zero. It also doesn't prevent infection from somebody else. Having said that, Dr. Yu has also said that if somebody feels that they should be wearing a mask, a fabric mask, and want to bring one in, she has said that she is fine with that for county employees. I think there's some guidance that's being pulled together to do this for Dr. Yu to send out. We're hoping to get that to the county manager later today.
One follow-up, Kurt. So what I understood you to say is that for jail personnel, as an example, they are getting PPE supplied through county. They're within Tier 2.
That is correct. And we're working that through ESF 13, the sheriff's office. So we have a representative here from the sheriff's office that's part of the ECC personnel, and that we have provided them with the latest was last week. We gave them supplies, but at the same time, we've asked all law enforcement and jail personnel to do a mitigation and conservation process because we do not have unlimited PPE. Essentially, we're taking right now from EMS personnel to give to law enforcement personnel.
But just to clarify, the masks they have provided to law enforcement and corrections officers are the surgical masks, not the N95 masks.
Initially, we're providing N95 masks, but the guidance from the CDC says surgical masks are intended for law enforcement because N95 masks are needed for medical personnel who perform medical procedures.
Yeah, I just want to make sure that you highlighted that. Yeah, thank you.
As well as, may I follow up on you?
Yeah.
As well as, this is Hutch, Kurt, is, since you have TCSO represented there, are the corrections officers allowed to wear the masks on duty?
The corrections officers have to follow the protocols that are established by jail personnel. I cannot answer that. I do not know what their protocols are.
They should. Yeah.
Okay. Okay, and that policy is set by the sheriff?
I would assume so, or Chief Doma there at the jail. I'm not sure who set that policy. I have to defer to the sheriff's office or the jail personnel.
I had a constituent comment that corrections officers weren't supplied masks, or they're not allowed to wear them. And this individual was appalled. And
Okay.
so I just didn't know what.
So I would have to defer to sheriff's office, but I will tell you something similar. I can speak to EMS, and I will tell you that EMS guidelines are not to mask up for anything. In other words, somebody might be appalled that EMS are not wearing a mask in a certain situation, but they are wearing a mask in another situation. It depends on the protocols and the requirements that are in place.
Okay, the public might not know those if we don't.
Correct.
You have more on that?
No, that was, I think I secondhand kind of heard the same thing. I just wanted to figure out what status was.
Okay.
Because to me, the jail folks are, I can't think of a group that's more, at risk, even amongst the sheriff deputies. I would say the jail staff are on the front lines to the nth degree, and
Yeah,
I was
certainly.
surprised to hear that complaint.
Yeah, well, I was surprised to hear it, but also understood that that individual might not know what protocols were in place, and that we don't dictate what the sheriff does within his office per se. But I did, on the way into work, I passed an Olympia police officer, and he had a mask on while he was driving in the car, but it wasn't just a mask, it was a bandana. And he rather looked like Jesse James or something. Looked pretty, I thought it was pretty ominous, pretty cool looking at the same time. Seeing that bandana mask on him. Go ahead.
Kurt, just to conclude, and correct me if my statement is not correct. So I believe that we have met all the requests so far from corrections officers to provide PPEs, masks and gloves. Is that correct?
That is correct. And I will tell you that the challenge is becoming, as we have a shortage of PPE,
You're right.
it is going to be more and more challenging to continue that. But to date, we have met the request that we've received from the sheriff's office.
Okay, and that is important. And also, all depends how the stockpile dwindles down in the days and weeks to come. That might be a different conversation in terms of priorities.
That is correct.
But then just to put the cap on that, but we have new guidance and new policies that in that instance, they would be permitted to wear a fabric mask.
That could mitigate that,
To
yes.
mitigate the shortage.
Yep.
Okay, hopefully that's a positive change.
So I just want to circle back to Commissioner Edwards' question about the information that we're not getting. And want to be sure that Elizabeth knows as well, since she's listening, that we're not looking for any specific individual information on an individual that would compromise his or her identity or violate HIPAA in any way, shape, or form. But we do want to understand your frustration. I'm going to sense frustration, because you did ask this last week, and I kind of expected an answer this week, and we don't have, we're asking again. So, go ahead, Gary.
I would just like to follow up on Commissioner Mentzer's bringing up this masking issue. I think it's a good example of the rationale that I'm using on this particular inquiry, if you will. For quite a period of time, it was recommended no masks, for whatever reason. Now they're saying, well, they didn't want the public hoarding masks. I don't know what the reason is, but as the situation developed, then the criteria has changed on what the public is supposed to do when it comes to distancing, masking, that type of thing. So I think it is very important that we know, for an example, how many people are in the hospital right now being treated? That gives us an idea of what we're up against. How many are on ventilators? That gives us an idea of what we're up against. How many have been released? How are we faring when it comes to comparable national statistics? I see nothing wrong with us gleaning this information now before we go into, I would hope we would never get into a second stage. But it's very possible that we could, and I just can't stand bureaucratic process that delays us from getting the job done. So that's where I'm at.
Okay.
And I would like to know who's running the place. Are we running the place or is staff running the place? We need to know when we can get some answers.
Okay.
So I guess I'm done for now, but I'm gonna be pushing this topic. I want everybody to know that.
I would like answers before, probably summer, when it's all over, hopefully.
Well, I would like answers the next time we get together and preferably in the next 10 minutes. I don't see any reason we don't have legal counsel in attendance at all times that can give us guidance. We're not lawyers. We're not expected to know all this stuff. We should have, the health department should have an attorney with them there if those are concerns they have.
Elizabeth heard the conversation and she's going to be looking on the details of the HIPAA requirements and what.
No, I can tell you, I'm pretty familiar with HIPAA rules, and HIPAA rules are releasing information on individuals, not demographic information that we could utilize.
Yeah, and maybe saying someone is 80, that's not a violation, then saying they have an underlying condition, that's a violation, I don't understand. So Elizabeth's on it, she will look at it and get back to us as soon as possible, I would hope.
And also, every day we get a very detailed information from staff and daily reports. And I don't know if you had the opportunity to review those reports.
Incident reports.
The incident reports, which breaks down a lot of that data to a certain extent, in terms of demographics and ages, sex, and everything else, and compares to other counties, compares to the national level. So, and I can probably bring that information the next time you get together just to go through that. But all of us receive daily reports and daily updates related to that.
That's a
Not,
situation.
okay, no. How many are in the hospital right now?
No, not necessarily to that, is an additional information that you ask, but there is a wealth of information already provided to you. So I think you're asking more than that, and we'll look into how we can get that information to you.
All right.
Because I'm not privy to that.
Commissioners, this is Shelley again. I just wanted to acknowledge Commissioner Edwards. I hear your frustration. I understand the Board of Health would like more information from us, and I will work with legal counsel as well as Dr. Yu to try to address some of those concerns for you.
Thank you.
Thank you.
I'm just trying.
And this is Kurt Harden again. Would it be possible also to get a list of what information you're seeking? That way they could have something that they could go down. I'm not saying all that information could be released, but if we had a list of the specific information requirements, that way Elizabeth Petridge could look at it, Dr. Yu could look at it, Shelley can look at it, and that way we can see what we can do to meet that.
Yeah, this is what I have so far, Kurt. Ready?
Yes?
So the commissioners would like to know the overall location on a map, if that is possible. General location as to, somewhat of a spot map of the, I believe right now, 68 cases. Also, I believe the commissioners would like to know, out of those individuals who are in the hospital, not necessarily in ICU, but in the hospital, whether any of those have underlying conditions. And also, how many of those individuals are currently using ventilators, if that is a data point. How many individuals out of the 68 have gone to the hospital and that have been released from the hospital? And how many out of the 68 they have fully recovered without going to the hospital.
And I'll circle back.
Did I?
How many are in the hospital at the time we're getting a report? That would be part of it.
I mean,
Another
did
part, though, that's
did I
missed.
capture?
Nope, I think what's missed is if we hear an 80-year-old passed away or an 80-year-old's been diagnosed and they live in a group home, I don't understand why that would be a violation. If it's not a violation, I can't understand why saying, and this individual had pneumonia, why that's a violation any more than, hey, a 19-year-old got it and there was no underlying conditions. It's the same information.
Yes.
I don't know why that's a violation or wouldn't be a violation. They had no underlying health conditions, but it's a violation if someone did have some. I don't understand the logic there. So that's what we need to get from legal.
On that first parameter about geography, are you interested in where they live or where they contracted the virus?
Well, I think just in general, where do these people live? I mean, if they're living in a senior center, a senior home or assisted care, I don't need to know the name of the operation. I just want to know generally where the problem is, because we don't know what we don't know. So sometime down the road, 6 weeks from now, we're in a relapse and we can take a look, well, where's the hot spot at here?
Yeah, I mean, that one's tricky because.
It is tricky.
Where they live is likely not where they.
Hey, Brian, can you go open the sheriff would like to come and have a conversation with the board. Can you open that door, please?
But whatever, we get whatever we can get.
I mean, even as deputy sheriffs, for an example, I mean, deputy sheriffs should know if they can know. We could put that on our CAD system, for an example. I don't know if that might be a HIPAA issue, but if a house had somebody in it that was recovering and they're gonna respond there for a domestic violence or whatever it is, I think we should have information.
And if we hear they live in a group home, or we hear they live in jail, or they live in prison, why can't they wait here? Well, they live in Southeast Olympia, or they live in Northwest Olympia.
Yeah.
I mean, just.
I want a general area. I don't think it's asking too much.
Yeah, and 67 is far too many, but it's not gonna cover the county with pins.
No.
So you can still do that logistically. You might understand the sheriff cannot get into our building.
It's just a matter of access the door.
The
And,
door's locked, the sheriff can't get in?
well, they have the ability to contact IT to ask him to access service. I don't know who has access.
Have a key code or a card?
He does, but each one of those is depending on where you go, is given the access.
Oh.
So,
That's not available.
under Sheriff Braniff asked me that, I said, please ask IT to grant access.
Yeah.
I don't know if they have done that.
Oh, good gravy, good gravy. There's a shooting. Oh my gosh, we can't get in.
So I wish that I can have all the power in place to click and give. Yeah.
So we're gonna go to that item now.
Yeah, I think the sheriff might be coming right now.
Jail one?
Whatever items involves the sheriff that.
I would say so, yeah. Was there anybody else online
I think
that wanted to weigh in on this before we turn it over to the sheriff eventually?
The sheriff just sent me a text that he would like to address the statement that Kurt had related, they were providing masks, so.
Okay.
Are you there still, Kurt?
I am.
Okay. So the sheriff might be on his way.
There he is. Good morning, Sheriff.
Good morning.
Oh, sit at the table, huh?
Plenty far away.
You're still you're enough away from us, but they'll pick up on the mic.
Brian had to make sure he stayed far enough away from me too.
You don't have a card to get in this building, Sheriff?
Or a key. So that's my complaint.
Well,
I would like that taken care of.
you need to put a request to IT to give you all the access that you need.
Yeah, so there's a request made,
I don't know if the locks have been changed or not.
but has request been to Dennis Osorio about getting that taken care of for you?
I'll find out.
Apparently, okay. All right, go ahead.
I was waiting for you all to have the questions for me because I was listening.
Yes.
And I know that there were some questions of the sheriff and I said, since I'm listening in, I might as well, I didn't have the number to call him.
Well, someone suggested, that's gonna go right to your issue, but someone suggested to me that since I the commission controls the budget, and we can set any kind of HR policy we want. And even though you're an elected official, I should be dictating that policy that your corrections officers can wear masks in the jail. So I didn't know if they had masks, if they were surgical or N95s. And so Commissioner Metzger and I, we have that, what is going on? What's the policy? Can they do it? Do they not do it? Do they have sufficient
My
masks?
staff, all of my staff do have masks, and they're asked to use it when they feel that it's necessary to wear them. Whether they choose to wear them all day or at certain times, whether they're on patrol or in corrections, they all are available. Kurt had mentioned previously about the sheriff's office having masks, and they all are available to have masks. So yes, they do have them, and it's when they choose to wear them.
So corrections are not prohibited from wearing them?
No,
Okay,
it's not, they're not mandated to have to wear them.
Yeah.
But if they deem it necessary to wear one,
They have the masks
they
available
have
to
to
them.
ask to put them on
Okay.
them, if you will.
We had heard that they weren't allowed to, at least at some point in the past, and I just wanted to make sure that
Yeah.
it wasn't true or had been changed with the new guidance.
I'm sorry that if that was said, it's not true, and since this has all started, we've been working very much so with Kurt on this aspect of making sure that law enforcement corrections are available to having masks.
This will right back to, don't get your information from social media, because that's where the complaint came in, this policy says. I answered, I'm not aware of that policy.
I would definitely make it very clear that if the men and women of the sheriff's office did not have masks, you would be hearing it from me personally, because of the extent of this COVID.
Do the inmates wear masks, or do they have masks available?
Not at this time, and I'm sure you all are aware that when we do bring somebody into our facility, they're in a, if you will, like an isolation for 72 hours before they're introduced into a pod, if you will, or into the dorm. So they're checked by medical staff every day to ensure the safety of not only themselves but the others in the facility.
Are they upon booking and the pre-screening, are they given a COVID test?
No,
They're not, okay.
no, they are asked questions and they are seen by medical staff though. We don't have sufficient tests to do a test for each individual, and especially with the turnaround time that it takes, usually 7 to 10 days.
And we generally don't hear a lot of, probably like you, a lot of agents who do a great job. We get the other side of that. And so the other side is that, I guess it would be the question, who is not being booked or who is being booked? What type of crimes are being booked?
So,
If you commit a
the
DUI,
type
you're
of
going to
crimes
jail.
is
But if
we're
you commit
doing-
assault downtown or a felony drug downtown, you're not. So I don't know who you're accepting.
So what we're doing is person-on-person crimes, whether it's assault. I want to kind of clarify whether it's assault third, individual on a law enforcement officer type of crime, person-on-person with violence. But for the, if you will, if we see two people scrapping, it's gross misdemeanor stuff. We're not booking them into jail. We're domestic violence, mandatory booking, so we are doing that. And if you have a DUI or one or more DUIs within 5 years, that we're booking down. But we're trying to limit our booking, and the judicial staff have been really expediting on a lot of turnover about whether the individual is being released or staying incarcerated until trial, so.
The information, okay.
Yeah.
Commissioner Edwards, any questions?
Well, the only thing I would ask maybe of the chair, while the sheriff's here, if we have no other questions for him, maybe we could bounce to commissioner items. I see we've got an issue directly affecting the sheriff on number 2 is hazard pay. And I thought maybe we could bounce to that, address that, because otherwise he might want to stay. We want to get him back out there working, keeping us safe. So I just ask for your indulgence in that.
I would while you're here. I'm not sure, I know kind of where it's gonna go, but it'd be nice to do that while you're here, if you don't mind. Do you have any questions with the sheriff before we get into that?
No,
Right on target, what else?
So before you move to the commissioner's items, I'm looking at the daily report that all of you received, including myself. It's very comprehensive, may not necessarily address all the data points that you're asking. But if you like, we can probably have staff print those reports on a daily basis for you to be aware.
You talk about the situational reports?
Yeah, and just to give you an example, and let me just walk you through on the data that I have. It does, it goes through the process in comparing across the state, some of the cases, some of they currently have, how many deaths, obviously, how many they have recovered, and that is in comparison to other counties. They have information related to hospital surge. There's a lot of good information in here. It keeps track of, flattening the curve on a daily basis. Also, it tells about how many out of all the tests, how many have returned negative, the percentage of the negative tests, the percentage of the positive tests. Out of the confirmed cases, they split on age groups between less than 19 years old, 20 to 39. And also there's a lot of information related to how many test supplies we have available as to that date. So if you like, I can probably on a daily basis have a staff to print this report and be available to you in addition to the information that you're requesting.
I get that report by email and I read it, but I don't need a copy of that.
I don't need a copy of it either. These are specific questions that I'm hearing from constituents that ask me, well, what's going on? Are we seeing issues like the national scene, for an example? I don't know if I can't comment on them. I don't want to get a book of graphs and everything. I just want some basic information that's simple basic information and what we'd be able to use in the future.
Okay, so we're working
If
on
I
it.
can say something on that. The ECC is doing a tremendous job on this and the reporting, working with Department of Health and Shelley's team. However, when we get that information, it's how it's shared and showing what a success rate we are seeing in Thurston County. And the unfortunate part is we're not subject, or we're not seeing the positiveness of what social distancing has done for this county, or what washing your hands or staying isolated really has done for this county. And in my personal experience and just looking at what we've been through in the last few weeks, we as a county, in my opinion, have done a great job, but I don't think it's being shared to the citizens of Thurston County, like Commissioner Edwards is saying. I really think that if it is possible, and I'm not that data guy, but to be able to share with the citizens, all we're hearing is that we're going to see the worst this week or next week or whatever, but we're not seeing the positive of the people who've had it, who have recovered, what our recovery rate really is. It's 80-some%, but we don't talk about all that great stuff that's really happening. So it would be pretty cool to be able to show the great work that Department of Health and Kurt's team and ECC is doing to make sure that things are going the way we had hoped or hoping to get. That's all I guess is my personal opinion. And I get the same questions, sir, so.
Yeah, a little more positive spin is, I'm not trying to dissuade people from following all the rules we've got laid out. But I do think it is important that we not continue to just go with the negative and basically scare our community. We should let them know what kind of recovery we're having. Yes, it is. It's more apt to get you. So protect your grandparents or your parents. But, I just don't like this stifling of information. That's kind of where I'm at on that. Okay.
So,
The majority of people with COVID-19 in our community are recovering or have recovered.
Thank you.
Okay, let's move on then to commission items, if that's all right. This is hazard pay. And do you want to frame that?
Yeah, allow me to frame it, Commissioners. And this goes back maybe 3 weeks ago when I sent an email that the hazard pay, at least from my point of view, based on the budget restrictions, was not going to be available to not just for the Sheriff's Office, but also to all individuals considered to be part of the essential business. As a result of that email, you received an email from, I believe, a representative from the Sheriff Deputies Union asking the board to reconsider my decision. The result of that conversation is the majority of the board agreed to pay 5% hazardous pay to sheriff deputies while on duty, correction officers while on duty, and some personnel from the coroner's office who may be in contact, unavoidable contact. I believe you made the statement, the majority of the board, that from your perspective, there was unavoidable contact that those individuals might be facing, and that's the result as to how you implement the hazardous pay. You follow up with also including juvenile detection officers as well as security officers here in the courthouse. So the decision of that had brackets. It started on Wednesday, April 25th, March 25th, and ends yesterday, Monday, April 6, 2020. So as Commissioner Edwards stated, this whole thing is evolving daily and evolving in terms of how we're going to be able to adjust and respond to that. And at least from my point of view, the impacts to the county budget are going to be significant. And we, across the state, we start talking to all the counties as to what that impact will be. It becomes even more tasking because if we would know the length of this impact, we will be able to put our hands around and start building strategies. But at this point, we don't know. Adding to some of the actions the county treasurer stated, the delaying the property taxes to some private individuals, the revenues to the county are going to be diminishing. On Friday morning, the Department of Revenue also delayed for a small business the submittal of the excise tax, including the sales tax. And that by itself is, I believe, is a benefit to the small businesses, giving that relief as to when they can submit their taxes, but also it's a delay as to how much the counties are going to be receiving here in the upcoming months. So as I stated to you last time, and I continue to state to you, my biggest concern is how the county's budget is going to be fair after this is at least somewhat of a normal situation. And last time you asked how much this 5% represents. Unfortunately, Maria is working. We're just right now closing on the payroll for this pay period, so I don't have that information to you. I was hoping to get that soon to have this conversation, but unfortunately, I don't have that email from Maria yet. But still, my concern is still present and grows by the day, because even if it's $500 or $5,000 or $10,000, it is going to be an impact to the county, and it's going to be an impact to the county that at the end you're going to be facing with very difficult situations to how you may need to mitigate, and the offices and departments may need to mitigate the gaps on the revenues we're going to be experiencing this year. So this is leading to my consistent recommendation to you that you may consider stopping the 5% hazard pay across the county. And my recommendation as the days goes by grows stronger. And I'll stop there.
Do you have anything to say yet?
No.
Okay. out of concern brought to us by the Deputies Association, we acted on that. I haven't heard any feedback yet as to whether that's good, bad, or indifferent. But I did receive a comment from an employee, one of your employees, that save your 5%, we want time off instead. So I don't know if that's a credible offer or not an offer, if that's happening or, I don't know, I have no idea, and I don't think you do, but maybe you do, what the association thinks of that, instead of the money. It's kind of considered soft dollars, but if it's comp time, it's cashable at the end whenever they want to cash it in. So it is hard dollars as well. So it's too bad you don't have the information yet on what's costing, but we have time to get that. Go ahead, Gary.
I think this is a way that we can recognize their service to our community. For years, I believe deputy sheriffs have been under-recognized, and as have other uniformed personnel that we often put in harm's way. I am very much an advocate for continuing the 5% until we're back to, I'm not going to say back to normal, because what is normal?
Yeah.
But I am
What
going to
is
say
normal?
until we get back to where everybody is back to work, at least, to where this stay-at-home order has been lifted and we're kind of back to maybe the new normal. So I'm going to advocate to continue with the 5%.
Oh, go ahead.
I don't think it's responsible to bump anyone's pay when we have budget cuts and layoffs looming just around the horizon. I oppose this, starting this, and I certainly continue to oppose extending it.
And I agree that the sheriff or law enforcement in general is under recognized or compensated, especially if your deputies are with comparable counties and such, with your comps are about 51, 52, 53% of the pay. However, if there's another way to compensate them in a way that they're amenable to it and happy to save the hard dollars now to forestall any types of other more grievous, serious action, and they're happy with more time off rather than just additional time off rather than the hard dollars. I just don't know where they are on that. Go ahead.
I just want to make sure, and that I want to be perfectly clear. My suggestion to you is nothing related that I do not support and that I do not appreciate what the sheriff's office does, what the sheriff deputies do, and the hazards they face on a daily basis. It has nothing to do with that. I am not in the position even to judge that because my level of appreciation of what they do on a daily basis is unparalleled. My only suggestion to you is based on the current and perhaps future financial situation of the county related to this emergency. And I believe that is my obligation to suggest to you as to how, when, and how you make financial decisions that may affect that.
I agree, you're looking at the bigger picture, you're looking at the much bigger picture, and it's not to devalue the sheriff's office or uniformed personnel. But it's a fair question to ask. Where can we go? Do we stay, or do we alter it? Do we reduce it? Do we go to comp time off, compensatory time, which is still, it's still hard dollars, but it puts it off, delays it a bit. I got two hands raised, I don't know who went first.
Well, I just wanted to echo what the county manager said, and Olympia, for example, gave hazard pay to a different set of employees, non-law enforcement, and I would have opposed that. So it's nothing to do with respect, absolute respect for the work you guys are doing, and that you're closer to the front line, perhaps, in certain ways. So it's nothing to do with that. I absolutely respect the sheriff's office, and I'm thrilled with some of the things that you guys have. I'm thrilled with how you've responded to this crisis and with the jail, and I've had a lot of interaction with the community and been very proud to report on all the things that are being done. So I just want to make that comment. This is just about the dollars and cents of the budget, and I'm just really concerned about what's around the corner for us.
Before I get to you, Commissioner, I just want to add that I met with all the mayors in the county last week and virtually, and they said, these are my words, not theirs. What are you thinking? We're not giving any of our people specialty pay, let alone uniform personnel, but Olympia did say they did a different group. And you're putting the pressure on us. Okay. live with it. Go ahead, Commissioner.
I guess, this topic, it sounds like it's winding down, but, I'm not gonna have any problem as we move into the future when we make decisions, because we have already decided what is essential and what is not. So if you're not working right now during this period of time and you're not essential, that's where my priorities are gonna go towards budgetary examination. So I'm not too worried about it. We're gonna have to set priorities as we move forward, depending on what kind of revenue restrictions we're up against. I think I've got some innovative ways to address this, because I don't think we're gonna be locked in to doing business the way we've always done business. We're gonna have to think of a new way of doing business in the future. And that new way, I believe, the law enforcement community is gonna become even more important than they are today. And I just think this is a token amount to show our appreciation for everything that they do. And I don't care what those other jurisdictions have to say about it, because they've never appreciated law enforcement until they need it. You know, it's kind of like insurance. You know, everybody has insurance, but you don't need it until you need it. And that's the way I look at law enforcement. And I want to keep law enforcement as the highest priority that we're dealing with.
And I'll get to you, Sheriff, in just a moment. I keep my eye on the budget, but I also understand the equity theory. And when people are considered non-essential, how do you not take that personally? Or you're considered essential, but you're not getting anything vote for it. And so the equity theory keeps saying, well, gosh, this group is getting it, not law enforcement out there in the street, in people's homes, but a group is getting it. And I'm handling paperwork, I should be, I'm exposed, I should get, so we have to deal with those pressures as well. The equity, I can deal with that, that's easily enough done when it comes to comparing job descriptions. And I don't have any problem in doing that, I just don't. Romero.
Really is how the board would like to move forward. At this point, you heard my perspective, and
Do you want to?
Are we,
Could I make comments?
oh yeah, please, can I have a question for you? Go ahead.
So, since this has started, first off, I really want to say thank you for the kind comments about the sheriff's office and how hard the men and women work for the citizens of Thurston County and the state of Washington. There are electeds who do make decisions, whether you decide to hold off paying property tax or not. That's a decision that the treasurer makes. It's not a decision I make. It's a decision that the treasurer decides that whether you have to pay your property taxes now or you don't have to pay them right now, which obviously affects the budget and how it affects your decisions. Other comments are made about that because we're law enforcement, that we know the hazards that we enter, which you're right. We do know that there are hazards that are in law enforcement. But kind of going back to the priorities of government and what law enforcement is. Law enforcement is our job to keep the calm. Law enforcement is for us to hold people accountable for what's going on in today's day and age, of which we've never experienced before. We've never seen this. None of us ever have, yet alone ever imagined. But we're the ones, law enforcement, are the ones dealing with the people who aren't dealing with this very well, who are scared. And they're scared because what do we hear every day? Something negative. When do we see the news and there's a positive thing said about how many people, kind of like what Shelley was saying, about how many people are doing really well surviving this COVID? But we don't talk about that. We talk about all the worrisome things that are really going on. And it's our job in law enforcement to make sure that we try to keep the calm and tell the people out there that we're out there for them every day. I get the budget. I get it because I'm held accountable to my own budget and the responsibilities that go with it. And that what I have to answer to you three about why I'm over budget or not. I would rather be under budget, just to be honest with you, but my point is that I hold myself accountable for all of this. And the men and women, I think, are putting themselves out on the line every day for the citizens of this county. Do I think they deserve it? Absolutely. Do I think that they have a choice? No, they don't. They don't have a choice whether they get to come to work or not. The reason why they don't have a choice is because they swore an oath, not only to the U.S. Constitution, but the state constitution, and to the citizens of the state of Washington and the citizens of Thurston County. They swore an oath to serve and protect. And that's what they do every day when they come to work. Not just law enforcement, but the corrections. They do it every day. Do they want to? I guarantee you, would they rather stay at home and be with their family to ensure that they're safe and isolated? Absolutely. But that's not the job that they live in. That's not the world that they're in. They're out here because we asked them to, because they took an oath. And I admire each and every one of them for doing that. And I will stick to my guns on that one and say, do I think they deserve it? Absolutely.
So having said that, you say they don't have a choice. The only choice they made is to enter the field or the profession. And once you enter that profession, if you think you're in charge of your own destiny, you're sorely mistaken, because others are in charge of that. But I know you don't speak for the associations within your department, but do you think that your staff, and I mean staff, everybody from the one who may be in the academy right now, on the way up, they prefer the uniform field ops, the 5%, or they value more time off?
So, excuse me, but you're getting into negotiating with a union at this point.
No, I'm just asking if he had a feel as to what a sense. No, I'm not trying to negotiate anything, but just get a sense that, oh, they want the money. Okay. No, they don't want the money, they want the time off.
So
And I'm just asking if you had any sense of that. Is that,
I would like to make a comment on that, is that you heard from one person.
Okay. Thank you. That's enough said then. Commissioner?
I would make a motion that we continue the 5% until this lockdown situation is over and get back to some normalcy.
Okay. Commissioner, anything? Okay. So when I make a motion, I guess a thumbs up is,
However you want to do it.
until I get more direct feedback from Maria, their HR, is what the hard dollars are. And this, we did this before, it was extended all the way through May 4, I think, what is it, April 28th? April, what is this 5% end?
Yesterday.
Oh, yesterday.
No,
I
but
was
when is
so
the
close.
next extension? When is that?
Oh, the stay-at-home order goes until May 4th.
May
May 4th. So until May 4th?
I'm in favor of keeping it in place. I want to see what it's going to cost though, to kind of, just so I have a figure in my head. But I'm in favor of keeping it.
So I don't
You want thumbs
understand.
up?
Okay, so
5%.
can you verbalize that, because some individuals may be joining via conference call. So let me see if I can frame the Commissioner Edwards suggested that he would like to continue to implement the 5% to the groups who have already approved
Yes.
until May 4th.
Yes. That is exactly it.
2 thumbs up. Hutchins, yes.
No.
Gary, yes. Commissioner Messer?
No.
No? Okay. All right. Sheriff, anything you're welcome to say, but you have other stuff to do.
Thank you very much, and again, I just want to say that all of your comments are really appreciated, and thank you for those comments. And I really sincerely want to thank Kurt and Shelley's teams for doing all the hard work, for what they're doing. And it's unfortunate, but they are doing a lot of great work as well. And I'd really like to see, like Commissioner Edwards said, the positiveness stuff come out, because there are a lot of great things coming out. Do you hear me, Shelley? Thank you for your time.
Thank you, Sheriff.
I appreciate it. Thank you.
Thanks, sir. Be safe and stay home.
Thank you.
So I may need to bring a document just to formalize your decision. on this.
And Kurt, if, it looks like you're still on, and if you're near Shelley, please pass on, not only the sheriff's, appreciation, but mine as well. I know you guys are working through the weekends on this, when a lot of people are taking the time off, on the weekend, but you guys are devoted to this every single day. I thank you very much for that. Okay, then, we're moving on. Homeless strategies. Keely, are you there?
Keely, Tom,
Anyone?
are you there?
Anyone? Oh, Tom?
I see Tom up there.
Can you hear me?
Ah, yes.
Okay, great.
Can
Good
you
morning.
hear us, Keely?
Yeah, I can hear you.
Okay, good.
Great. All right. So, always much going on with the homeless response. Carrie Hennon has been assigned to work with me, and I've also made requests for 2 other individuals from public health to join the homeless response effort in terms of planning and really exciting, we have requested that our new staff member, Ariel Benson, become our quarantine and isolation coordinator. So we'll have one person that will be kind of coordinating all of the placement, the transportation, information for medical providers and homeless service providers. So hopefully that will be up and running by the end of this week. Ariel will be prepping prior to that. And we also will be utilizing the coordinated entry emergency shelter hotline as our quarantine and isolation kind of what's the word I'm thinking of? Anyway, you can call that number and get to our quarantine and isolation coordinator. That's primarily for homeless service providers and medical providers, but it's a number that's available to the community. But its intent is to ensure that people who need placement in quarantine and isolation beds will have one point of contact call. We're working very closely. In fact, Carrie's in a meeting with them right now with emergency management and the IMT to make sure that our quarantine and isolation plan is thoroughly developed and all of the tasks are appropriately assigned. We're, as Shelley said earlier, if we need to go, we can go. We can get it going. And most of the most important details have been worked out. Outreach activities continue to encampments through our outreach league. They are continuing to bring survival gear out into those encampments. I meet with them every Wednesday, and so I'll be able to get more of an update. But as of last week, they were still operating a very robust outreach effort. We are working daily with the City of Olympia. We have a 3 p.m. standing meeting to ensure that we're collaborating and communicating and just in lockstep with each other. They're working really, really hard right now. They're down some staff, but they've just hired 2 temporary hires to ensure that the important work that's happening to address homelessness generally and in response to COVID-19 is going to operate and continue operating smoothly. Some exciting sheltering news. Sacred Heart Church has opened up a hygiene center during the day from 10 a.m. to 2 p.m. That is largely due to one individual who has just been amazing this year. She's an amazing addition to the homeless crisis response system. Her name is Kim Conrad. And she has taken what was a 13 to 14 bed men's only shelter at St. Michael's Parish in Sacred Heart to a 30-person shelter for men at St. Michael's, and almost single-handedly organized this hygiene station at Sacred Heart. So that's very exciting. She's looking for volunteers to help staff that. Last night, Interfaith Works opened the overflow shelter at 2828 Martin Way. That was incredibly swift turnaround for that crew and the City of Olympia to outfit that building to ensure that there was a place for folks to go that may have been displaced due to social distancing in their home shelter. So very excited. I'm going to be stopping by to see how they've transform the place and just check on that crew. So it's very exciting. The mitigation site has transitioned over to Catholic Community Services in terms of its operations, and that is super exciting in terms of the level of supervision and oversight that will be in that provided by Catholic Community Services. And then our increase in meal production and meal delivery is through Community Kitchen, again with Catholic Community Services, is underway. So our homeless response system is just doing an amazing job. I have never met a more dedicated group of individuals. They are volunteering and working 24/7 also. So I think that's about it for me.
Any questions, Keely?
Keely's Ty, the isolation and quarantine that we've been prepping has, do you happen to know, like in King County where they have more cases, how many isolation or quarantine units have they needed up there? I mean, what are we bracing for
We've planned for 300 beds to be available. It's a staged kind of approach. So starting with one hotel, if that gets full, then we'll move on to the subsequent hotels. We also are planning that if in case that the hotels become overwhelmed at that 300 bed capacity, that we would try to stand up a congregate shelter for people who are COVID positive. It's not perfect, but it is one of the responses that we've come up with. So that would be another 30 people. So at this point, we have 330 beds available for isolation and quarantine.
Do you know how many are being used up north? Like I know they bought a hotel we heard about, and is that full?
I'm sorry, I didn't understand. No, I do not know.
Okay.
I could find out.
No, it's okay. I mean, I can find out too, but I was just curious if you happen to know, like what kind of capacity they have needed up in north where they have a higher number of cases. But that's okay.
Right.
Thank you.
Okay. Mm-hmm.
No, sir.
Nothing?
Good. Thank you.
Keely, I have a question, and I'm blindsiding you with this, and Romero as well. The nearly $1 million grant from DOC, Department of Commerce for housing, do we still have money?
Yes, we do. We do still have money from that grant. We have approximately $225,000.
Because our, go ahead.
Oh, Tom's also on the line, so he could also help with that, answer that question.
Good. Because our behavioral health ASO, the VHASO, they also do housing for mentally ill folks coming out of jail and coming out of Western states. I'm wondering what the options are of funneling some money to them for housing for reentry. Again, blindsiding. Nobody's heard this because I just spit it out because I heard it late yesterday.
Yeah, I don't know how to 100% answer that question. I do know that in speaking with Director Slaughter yesterday.
Tom, are you available? Can you join us? Can you unmute?
Hi, it's Tom. Sorry, I was on another call, so I hadn't been listening in.
So can you walk us through as to what the requirements of the Commerce $1 million grant is? And high level, I think you have provided, I think all of us, what is the specific purpose of the grant? And that may be a way to answer Commissioner Hutchins' suggestion.
Tom, if you didn't hear it, I was wondering if any of that DOC funding or grant could be used for housing through the Behavioral Health Organization, because they house mentally ill folks that are exiting jail and or Western state. They house them as well. I didn't know if any of that funding was available.
Perhaps. So the purpose of the funding and I don't have the grant agreement right in front of me now, but was primarily for quarantine and isolation beds for
And shelter.
COVID positive, persons under investigation, and other highly vulnerable individuals, primarily focused on the homeless population, or other folks who are unable to quarantine or isolate on their own, in their own space. So potentially those folks that BHR could support could potentially fall on that. If they don't have a place to go, if they're highly vulnerable, I don't know what other underlying health conditions. So I'm waffling a little bit. And we can certainly ask those questions. I can follow up with Commerce and ask some questions. But I would say it's probably not the primary purpose of the grant, but it may be an eligible purpose depending on how it was framed.
Yeah, and of course, it could be argued that those folks exiting both facilities could or would be ending up homeless or in need of services and wouldn't be able to isolate. But I understand the parameters now much better than I did 2 minutes ago. Did you have something?
No, sir.
This is Keely.
Yeah, go ahead, Keely.
I follow up. I just wanted to share that yesterday when I asked a similar question to Director Slaughter, the guidance I was given and the direction I was given that the remaining $225,000 must be prioritized for quarantine and isolation. So if those individuals were needing quarantine and isolation, that would apply.
Okay.
And we might need the money because you heard about the number of beds that we have already,
Yeah.
spotted in the county through hotels. This is the grant that we might be able to use for.
Okay. All right, I'm done with that topic. Nothing further for Keely or?
No, sir. No.
And Tom, you're on here for another reason as well?
Yes, I am.
Okay, then you can hang out.
Lot interlocal.
All right, go ahead.
Oh, just before Keely hangs up, I'm really happy with the work that you and your team are doing, so thank you so much.
Ditto.
Thank you.
All right, thanks, Keely. It is 10:25. We've been at this for an hour and 25 minutes. We're gonna take a break. So we'll be back in ASAP, but right about 10 minutes. If you're on the phone, stay there or call back, whatever you want to do. We'll take a 10-minute break. Be back at 10:30. Thank you. You bet.
3, 2, 1.
All right, welcome back to the agenda setting work session for April 7th, 2020. We're going to review the BoCC draft agenda for, oh, that's right, today's BoCC was canceled. We're going to be, we'll be doing that shortly. Just going to move right on to the next item, and that's the BoCC draft agenda for the meeting of April 14th. Yes, sir.
Commissioners, you made a decision in fact, a few weeks back that you will assess on a weekly basis whether you like to cancel the Board of County Commissioners, the official Board of County Commissioners. You're not canceling your legislative action. Considering the current stay-at-home order that goes through until May 4th, I recommend for you to consider canceling all the Board of County Commissioners, formal Board of County Commissioners meeting through the month of April.
I support that. Do we have to do a motion for that?
No, just give me direction.
Support that. Yeah, okay. So the next week's is canceled, but we'll still go through.
Yeah, we'll bring the items as we move along.
So this is reviewing the agenda for April 14th, 2020, next Tuesday. And we have consent item A, that's just the vouchers, we'll get to that. Do you want to go through these, Romero?
Yes, sir.
Thank you.
Item 3A is your regular approval of the weekly voucher, and that will be for April 13, 2020. Item 4A on this agenda, this is a request for you to authorize the Public Works Director to get into an agreement with the state for us to receive $500,000 in federal money through the Surface Transportation Program to help construct the Beaver Creek tributary culvert along Case Road, and this is part of the fish passage program that you have in place. I think in the past, the board has been very, very interested as to how the investment the board allocated for this program through the Real Estate Excise Tax 2, REIT 2, can be used to leverage other funds. And this is an example as to why how staff has managed to leverage federal dollars to construct this culvert. And again, this is a recommendation for you to authorize the director to send the proper paperwork. In this case, is the local agency agreement to the state to secure the $500,000 from the federal government.
However, this is just to do the ILA, but that doesn't necessarily mean the money's there to give us, right?
The money has been allocated.
It has been already?
Yeah.
Okay, because I thought the screeching of the brakes at the state level would put a brakes on.
This is federal money, no state money.
Okay, good. Questions, comments?
No.
Ty? Good, okay, thank you.
So, and again, this is for your review. I will bring those items later for you to take a formal action. I'm not expecting you to take a formal action today.
Okay, it does say federal.
Item 4B also is related to the previous program. In this case, is for you to authorize call for seal bids to construct this, to secure the services of a contractor to perform the construction of this fish replacement. The approximate cost for construction is $820,000, and the $500,000 from the federal government. And the remainder, what we call the local match, will be coming from the real estate excise tax to the REIT 2.
So 320 from
REIT 2, yeah.
Okay, I do have a comment on this.
Yeah, go ahead, some of the similarities with A. Go ahead.
My question is, previous topics, we talked about budgeting, and so that's a concern. Is there any mechanism in place, because we don't know what the future holds, that we could have some kind of an opt-out agreement if, for example, things are the worst case scenario and we aren't able to proceed with this. So should we start looking not only at this contract, but other contracts that we're going to be engaged in the future, so that we'll have some ability to opt out of the contract, if you will, some escape clause, if we're just in a situation where we can't afford things anymore.
Right.
So it's just a question I'd like to have legal look into.
Yeah.
I know that hasn't been an issue in the past, but it might be an issue in the future, so.
No, that is an excellent question, I believe. And as we move along, but also I like to see this, since there's this federal money, we have the money, we have already allocated money. Then is an opportunity when the economy comes back up to provide a little bit of economic incentive here in the county to continue with that. But you're making an absolute great point, whether we need to start looking holistically as to how we can probably stop any particular contracts in the county.
I don't want to do that, but I think we have to have options.
Right.
Robin?
Good morning, Robin Campbell, Assistant County Manager. And I would just say that every one of our contracts in our standard boilerplate language includes a clause that allows us to end the contract if there are funding issues. Those are already there.
And we don't take a financial penalty for doing that?
We may have to pay for work that's already been done,
Yes.
but beyond that, we're able to end the contract. Most of them have, 2 weeks or 30-day notice, but there's definitely the ability to end if the money's not available.
Okay, thank you very much.
It also all depends on, particularly related to construction, this type of construction. I think it will be very difficult for us to stop halfway when the bridge is down and the hole is open. I'm just exaggerating. So we have to weigh in as we move along, but you're making an excellent point that perhaps we need to start looking as to how we can see.
Enhance flexibility.
Yeah.
There you go.
So, thank you.
Thank you, Robin. I have no other questions on B, do you?
No, sir.
No. Okay. VHSS.
Yeah, 5A, and I'm going to say this. Let me take you back 2 weeks ago. And this is a conversation that you had. It was related to the CIP, the Community Investment Partnership Program, and there was a request by the CIP members to look at some of the contracts that we currently have with some of the providers. Since the conditions have changed, whether we can provide a flexibility within those contracts to do more than what they stated to do. At that point, I stated to the board that I needed to follow up with Tom Webster related what's the color of the money, whether we do have the flexibility with the state of federal money that allow us to have that flexibility. I did have the opportunity to touch base with him. With Tom, and he stated this money from the CIP is local money. So there's really is not federal or state dollars. So the money that has already been allocated to those outfits is local money, and really is no what I call strings attached. So as a result of that, this particular item is for you to consider to a amendment to the current agreement with the Rochester Organization of Families, that's the ROOF, Kids Place After School in Summer Programs. That was the key of this agreement. And the current grant ends on June 30, 2020, which the board authorized back in 2017 to get into this 3-year agreement. That is left, what is left this year is on that allocation is $26,325. So the proposal for your consideration is to amend this contract since ROOF cannot provide the after-school and summer programs because the schools are closed. So they would like to probably to allow to redirect the CIP funds to support other programs and operational needs, including the food bank and emergency services programs, but it's still providing well-needed services to the community. So, in just that's what it is. And at some point, we thought that perhaps, the schools will be back after April 24th. That's no longer the case. So I believe this is a good option as to how you can consider, amending that agreement with ROOF, and ROOF will continue to provide services to the Rochester community.
Just real quick point of clarification. Thanks for being here, Tom. It shows the description is amending OOF. Is it supposed to be roof? Okay. And this is, CIP ceases on June 30th, right, Tom? It's going to be the HHSC, correct?
That is correct.
So does it still go as a CIP because prior to June 30, and that's when the money is being allocated?
That's correct, because this is an existing contract that was originally the CIP, so this includes a portion of United Way funding in this contract.
Okay, good. And what was the dollar amount? You said 6,000?
No, it's $26,325. That's what is left for 2020.
Beautiful, thank you. Questions?
Just a comment, ROOF does a tremendous job in the Rochester community, meeting the needs of families and kids, and I have every confidence that they will repurpose these dollars in a targeted and efficient way to continue to meet the needs of the community down there.
Absolutely, that's a dollar well spent. My only concern is, and it's jocular, if the kids are out of school, there's no more school the rest of the school year, how are they gonna know when summer's here? Okay.
When the teachers stop bugging the assignments on the email.
No distant learning, yeah. Anything more from my commissioners?
No, sir, no.
County manager, anything?
No, sir.
Tom, anything else from you?
No, sir.
All right, thank you very much for hanging out. So that's golden. Number 6.
Number 6 is a follow-up to the conversation that you had with CPED staff last week, where we walk you through a proposed ordinance that you might consider to extend some of the deadlines related to the build and land use applications for some of the key applicants. And that was in reaction to the letter and the suggestions that you received from the Olympia Master Builders Association, which they provided some suggestions as to how we can probably help the building community to overcome this, because obviously everything has been stalled and some of the permits have been lapsing, and the request was for you to consider, extending those permits with no much of an effort. Their request was for you to consider extending all those permits through the end of July 2020. And the staff, based on the presentation they provided to you, they believe extending it to September 30, 2020 is going to provide a much better flexibility to those applicants. So this is just for you to consider formalizing that ordinance. And if you have any questions, I believe Josh is online, as well as his Brett.
Go ahead.
I guess my only question would be, is that going to be, that extension going to be adequate? Because we don't know what we're up against. I know that was a request, and I commend CPED for recognizing the potential of needing to extend this, but due to unforeseen situations that we're completely not aware of yet, is that going to be adequate? Do we need to go to the end of the year or something like that? Just why not cover all the bases as best we can so it doesn't have to come back and we don't have to revisit it again? What would it hurt?
So the logic that you just stated, Commissioner Edwards, is exactly the logic that we used in moving it from July to September. And our presumption is that, yeah, we may need to come back to you, but this period of time will help cover that gap. And we can revisit with legal, who has been part of this decision, and if we do need to come back, we will, but we hope that this is sufficient.
It can always be amended again if it gets worse, but
I don't know the benefit of doing it, or to what detriment would it be to do it to the end of the year, I guess. That's all I'm wondering. I'm just trying to, think ahead. Maybe we're not gonna be as caught up as we think we're gonna be, so what would it hurt to go to December?
Commissioner, that's up to the board. We spoke with legal counsel. We took the information that was provided from our partners, and we provided you an ordinance. The only hurt that it would take is it's ready for action now. But if you'd like to do something different, we're always open to receive your input.
Okay, well, I'd like to extend it, just for the sake of extending it, so we don't have to do it again, because I don't think this thing's gonna be completely wrapped up. And I wanna be doing everything I can so that those folks from Master Builders are in a position to expedite the process of getting our economy going as soon as we're given the green light. And I don't know when that's gonna be.
Then we appreciate that.
go ahead, Josh.
I was just going to say, again, we appreciate that. The Master Builders provided us a presumption of July, and we went further and made it September. So
I'm even more benevolent than you are, I guess.
It's not about being benevolent, just about trying to do good for the citizens.
I just ate a half a gallon of ice cream. I might be hungry later, so I'll eat the other half right now. So I really admire what you have done, especially working with OMB and legal to make it happen. And we're flexible. We can adjust it if need be.
That's right.
Commissioner, go ahead.
My only question was, this is the same item we reviewed. This is just a formalization of what we reviewed last week.
That is correct.
Okay.
Yeah, and you're not taking an action today, and just reviewing the formal action that will be bringing to your attention either on Thursday or next Tuesday.
Yeah, I mean, I'm comfortable with the staff's proposal, which went 60 days beyond the request from the master builder, so I'm good with that.
And that's not poo-pooing what you're saying, but if it's gonna take us 2 years to recover economically and such from this, we can extend it till 2021, but I just want to do it at a reasonable pace.
I believe we are in a recession, and it's gonna probably take a period of time to get over.
Yeah, I
So
agree.
that's why I want to extend it. So I'm obviously gonna support, till September as well. I'm just opting to go a little farther.
Okay. So I took care of that. Thank you, Josh.
You're welcome. Thank you, guys.
Thank you.
And we're canceling the Board of Health meeting for next week.
Yes, sir. I mean, no, I'm sorry, that will be, I'm sorry, I just reacted to yes, sir. I guess that will be a conversation with the chair of the Board of Health.
We've done, I think that Shelley and I have discussed that and recommend doing that. I thought we discussed it as a board already, but
Yeah, there's nothing going on.
if we haven't, then that's my recommendation.
Yeah, I'm okay with
Yes,
that.
sir.
Okay. Next is proclamations.
So I used to say, yes, sir, yes, sir.
Just so folks know, the Board of Health can continue to act
Yep.
in other times and places on an as-needed basis, which we are.
So next is proclamations and awards, and I have a proclamation, and that's for today. Wait a minute, yeah, it is for today. So I'm gonna go ahead and read this proclamation, and this is gonna be mailed. Who are we mailing it to?
To,
Someone's gonna accept this. I believe, aren't
yes,
they?
United Way.
United Way. Oh, beautiful. Okay. This proclamation is in recognition of National Service Recognition Day. Whereas service to others is a hallmark. Hey, this is your job.
Happy to do it. National Service Recognition Day, Thurston County Proclamation. Whereas service to others is a hallmark of the American character and central to how we meet our challenges. And whereas the nation's elected leaders are increasingly turning to national service and volunteerism as a cost-effective strategy to meet their needs. And whereas AmeriCorps and Senior Corps participants serve in more than 45,000 locations across the country, bolstering the civic, neighborhood, and faith-based organizations vital to our economic and social well-being. and address the most pressing challenges facing our communities. And whereas National Service represents a unique public-private partnership that invests in community solutions and leverages resources to strengthen community impact, creating more sustainable, resilient communities by providing education, career, and leadership skills for those who serve. And whereas National Service participants increase the impact of the organizations they serve and demonstrate commitment, dedication, and patriotism by making an intensive commitment to service. And whereas the Corporation for National and Community Service is joining with the National League of Cities, the National Association of Counties, and local leaders across the country for National Service Recognition Day on April 7th, 2020. Now, therefore, be it resolved, the Board of Thurston County Commissioners hereby proclaims April 7th, 2020 as National Service Recognition Day and encourages residents to recognize the positive impact of national service in our country, to thank those who serve, and to find ways to volunteer and give back to their local communities. Adopted this 7th day of April, 2020, Board of County Commissioners.
I have a question, Amy. This is gonna go, a copy of this is gonna be sent to the United Way. Thank you, Chris Wells, and everybody in United Way for the work they're doing here locally, especially nowadays. Do we have local AmeriCorps, don't we? Do you know? I'm not sure. Do we have a local AmeriCorps rep?
I don't know.
Okay. Since they're mentioned, I thought, let's look into it. There's AmeriCorps or Senior Corps and send them a copy of this. If not, then we'll save the postage.
Yeah, we can do that.
All right, thank you. Thank you, Vice Chair.
Yes, sir.
Advisory boards and commissions. Angela White. Okay, so Packed Mountain Work Development. You wanted a chance to review the application of Angela White?
No, this is just a leftover.
It's a leftover. We haven't updated.
Approved it.
Yeah.
There's nothing new on this?
No, there is none new. We'll
Nothing?
update it. We'll update it for the next meeting,
Okay.
but we have not received anything new.
Okay.
Yes, with you.
And still boards and commissions are canceled at this point.
Did anybody on that topic, Ramiro, contact you about a virtual board meeting?
Yeah, I believe the Fair Board contacted, and as I expressed my concerns, all of a sudden it's going to be a surge of requests for staff to facilitate that. I believe in that particular request, Josh's staff is working as to how we can work through that. I think the nuance of that is going to be how we can meet the OPMA, but I think we have a good parameter as to how we can do that. The question is how we're going to make that available to the public. So I believe Josh is looking for some options.
Okay.
Great. Well, as long as there's good communication with the board, whatever we're doing, if they understand why we're doing it, I think that's important. They weren't sure.
PIO check-in.
Good morning, Commissioners.
Good morning.
Brian Dominique, Public Information Officer for the Board. So we continue to provide information to the public about COVID. So some just quick updates about that. The next letter to the community from Dr. Yu will be going out either today or tomorrow at the latest. There was a letter from the local leaders that included the commissioners, Mayor Selby, Mayor Kmet, Mayor Ryder, Mayor Foster, that went out on Friday, and that was well received. So that's on our website, and that's ran in a couple local news stations. We've created a series of PSAs that local leaders submitted, and we are hosting those on a webpage that we hope to get live today. And we're going to be sending a link to all the local radio stations so they can pull from that page and run those PSAs on the radio stations. And then shout out to Thurston Talk. They are running a 7-day campaign for Public Health Week, which is April 6th through April 12th. So each day they are posting and promoting an article that's going to focus on the work that public health does for the community, which is apt timing given the situation we're in. And then Megan wanted to pass on to you all that she's missing everyone, and she hopes everyone is staying healthy and sane. And for me, The Olympia Farmers Market is open on Saturdays and Sundays. I've been working with Commissioner Hutchings' office to do an interview with the operations manager down there to talk about some of the measures they're taking to promote social distancing, making sure people will have access to locally sourced healthy food options. And we're hoping to do that interview this week, and that should run next week.
So that would be curious as to how that's going to work, because just this morning, I saw news from LA of a farmer's market, and they draw a lot of criticism because there was a lot of people and encouraging gathering. So I will be curious as to how the social distancing will be practiced at the Olympia Farmers Market.
Yeah, so when I spoke with the operations manager yesterday, the lanes that go down the aisles are exactly 12 feet. So it creates just enough space for them to be able to do that. And they've got markings on the sidewalks that keep people 6 feet apart. From what I've seen in the news, it's been pretty well received. I haven't seen a lot of criticism on it, but that doesn't mean it's not out there.
No, it was one in LA, a farmer's market in LA. I guess the picture taken, it looked like it was a crowded farmer's market,
And contrast to that, this morning they showed Pike Place Market, and it is a ghost town. The place is empty. It was sad to see that.
Yeah.
But the Olympia Farmers Market is still promoting farm to table fresh food, especially coming into the springtime. And those poor farmers and such, this is killing them really. What they've done is, rather than have people come up to the stand and pick out corn, rhubarb, beans, whatever they want, a lot of these things are being pre-packaged, so people can come up, that's the package I want, exchange and leave. So you don't have a bunch of people handling all kinds of stuff. So they've taken some measures to keep the market going and enhance or ensure safety, people's safety. But I just want to do a piece to keep them going, let them know we care. And remind people, summertime's here, kids can eat fresh fruit and veggies.
Saturday and Sunday, you said, right?
Saturdays and Sundays, yeah. So they're normally open Thursday, Friday, Saturday, and Sunday, but because of COVID-19, trying to limit people getting out, they're only open Saturday, Sundays, and it's for food vendors, and I think they're allowing that sell soap. But we'll get more into that when we talk with Bryce, the operations.
That's an alternative to going to the big chain markets and going into Safeway, or I'm not going to mention anybody, going into the big chain markets and going into the produce section where there's lots of people. Hopefully it'll be a bit different. But it's an experiment, social experiment, is what it is.
And we'll be doing that interview with social distancing in mind. It's going to be done via video teleconference. So, yeah.
But I'm going to walk the market.
You are going to walk the market,
I have a mask. I'm going to go down and walk. Mm-hmm. Yeah. Anything else, TIO? Right?
No, sir.
Okay.
And just one final note, the Thurston Insider went out last week, and the messages that you guys provided to staff were well received. So
good. I'm glad to hear that. Pass our pats on the back to Megan too, and to you, Brian, for all you guys are doing.
Thank you, Commissioner.
This time. No legislative update?
Yes, I do have one. The governor signed mentioned to you the bill related to annexations. That was not vetoed. And also it was not vetoed, the elections bill to compensate the county for regular elections. That was a success.
He did not veto that?
Did not. And so we'll be drafting a letter of appreciation for you to consider signing to some of the legislators. And I have to give kudos to Mary Hall, because she has been championing this bill for at least 2-3 years. And so kudos to Mary if she's listening.
Yeah, she carried the Olympic torch on that one.
Yeah. And as you know, the governor vetoed several bills within the budget. One that perhaps has an impact on us was the $1406. And that was a trailer, what I call a trailer bill, that will allow us to use $1406 to cover administrative costs for local jurisdictions. That has been vetoed by the governor. So $1406 will not be allowed to use for administrative costs. That's what I understand. And also they have put some caps in terms as to how much the county will be meeting the high threshold of the tax, as you may remember that conversation. So that's what I know so far, what the veto of the governors could have an effect on us.
Okay. Anything? Yeah.
Can I ask for some, some information on HB 2405 for maybe next week? It's not a bill that I remember discussing during our legislative update, but I understood that it passed, and it relates to something called a CPACER program, which is a clean energy incentive program. And what I understood from a meeting I attended last week is that the state is required to put some guidelines in effect for local jurisdictions, but they've got till the end of the year to do that, and local jurisdictions are permitted to move faster if they want to. So just in terms of anticipating what that's going to look like and whether there's an opportunity to move more quickly, I'd like just kind of an overview of what.
So it's House Bill 2405?
That's what I was told.
Okay.
It relates to CPACER.
I look into that for next week. And I know the governor veto a lot of climate change bills along with it. So.
Very good.
Okay. Briefing or public hearing decisions pending?
No, sir.
All right. That gets us to our voucher list, these decisions pending now.
Yes, those are the items that you reviewed last week, and this for your consideration to take a formal action on those.
Okay.
The first item for your consideration is to approve the voucher list for the week of April 6, 2020.
I move to approve the voucher list for the week of April 6, 2020.
Second.
It's been moved and seconded to approve the voucher list. Any further discussion?
Yes. I guess in the future, I wonder if we couldn't do the dollar amount. The dollar amount is usually on there. I think the public would be interested to know how much we're approving. And I don't remember the dollar amount now, but it's between $2 and $4 million a lot of times. And I just think the more the public knows, the better off we are as far as involvement.
Will do.
Yeah.
Okay.
Any questions or comments? Okay, all in favor say aye.
Aye.
Aye. Motion carried.
The next item for your consideration is to consider appointing Ms. Angela Huck to the Area Agent on Aging Advisory Council. And this term, if you approve, will be from April 7, 2020 to April 7, 2022.
I make a motion to appoint Angela Hawk to the Area Agency on Aging Advisory Council as a member at large for the term of April 7, 2020 to April 7, 2022.
Second.
It's been moved and seconded to approve or appoint Angela Hawk to the Agency on Aging Advisory Council. Any discussion?
No, sir.
No. All in favor say aye.
Aye.
Aye. Motion carries.
Also, item number 3 for your consideration is to approve a contract with Cordent Health Solutions. And this to provide toxicology services in Thurston County DUI, drug court, and family recovery court, family court, mental health, and veterans court. And also associated with the pretrial services program. Superior Court had a bidding process back in November. After the board approved to go ahead and with that bidding process, they received 2 proposals. And Cordon was the one who meets the best specifications of those services. This contract has a ceiling of $200,000, and that's the ceiling. It's not necessarily how much will be spent. And the way this is funded is by is a fee service type of funding. So depending on the individuals who are part of this, the program will pay a fee, and that's how it's going to be funded, the toxicology program. So, and again, this is you are not authorizing, if you consider to approving this, total $200,000, that's the ceiling for the courts to operate under this contract.
And that's fee-based.
Fee-based.
So it pays for 100% of it?
Yep, that's my understanding.
Okay. Questions?
No, sir.
Questions?
No, I'll move to approve the toxicology services contract with Cordant Health Solutions in the amount of $200,000 for the term of April 1st, 2020 to March 31st, 2021, and to include Thurston County Superior Court, DUI Drug Court, Family Recovery Court, District Court, Mental Health and Veterans Court, and Thurston County Pretrial Services Diversion Programs, and to authorize Superior Court Administrator to execute the contract.
Second.
It's been moved and seconded to approve a toxicology services contract with Cordant Health Solutions. Any further discussion?
No, sir.
No. All in favor, say aye.
Aye.
Aye. Motion carries.
The next item for your consideration is to considering approving interlocal agreement with the Public Health Seattle and King County. And this is for us to access a more expedited, less expensive medicine to treat TB programs here in Thurston County. This is a continuation of previous agreements that we have with King County. And this proposal has the duration from April 1st, 2020 through September 30, 2020. So through the end of this year, I believe, and that's the fiscal year. And no, I'm sorry, this is 22. May I revise that? Is 2022? The motion.
September 30th.
September 30, 2022.
So 2.5 years.
Yeah, and that has a cost of $50,000 for the contract period.
We need to amend that.
No, because the commissioner has not read the motion yet.
Good, okay.
I will make the motion to approve the Public Health Seattle and King County Interagency Agreement for the 340B Drug Purchasing Program through the Washington State Department of Health TB Program for the duration of April 1st, 2020 through September 30th, 2022, and authorize the Director of Public Health and Social Services to sign the agreement and any amendments that do not exceed $50,000 total contract value and/or a 2-year contract period.
Second.
It's been moved and seconded to approve the Public Health Seattle and King County and local interagency agreement for 340B drug purchasing program. Any further questions or discussion?
No, sir.
No.
All in favor, say aye.
Aye.
Aye. Motion carries.
The next item for your consideration is an item that you have been receiving information from staff, and this is to interlocal agreement with the LOT, Clean Water Alliance. And this is to receive a grant from LOT that will allow us to build a sanitation trailer to serve the unsheltered population. I believe LOT is going to be having a virtual meeting coming up, maybe Commissioner tomorrow night will. I believe LOT is going to be considering giving a grant to the county to build this particular trailer. And this is just for you to consider formalizing this agreement and give the county manager the authority to execute this agreement with LOT.
Is that like 100,000 or 300,000?
No, I believe it's, Tom, are you still there?
Yes, I am. It's 75,000.
75,000.
Okay, thank you. Good job. Okay. Comments, questions?
No, sir.
I'll move to approve the interlocal agreement between Thurston County and LOT Clean Water Alliance for public health emergency support funding and authorize the county manager to execute the agreement.
Second.
It's been moved and seconded to approve an interlocal agreement with LOT for a hygiene grant. Any further discussion?
No, sir.
No, all in favor, say aye.
Aye.
Aye, motion carries.
The next item, Commissioners, related to the agreements of the contracts that we have related to solid waste. You reviewed those items last week. The first agreement both extends the existing contracts for 3 years with the option to extend one-time extension for an additional 2 years for a total of 5 years potentially. This is a strategy behind us to give us the time to go through the request for proposals, to negotiate the larger contracts. On the first amendment, deals with the tonnage that we operate on the transfer station, and has a baseline of $2,019 in this case, but also has an escalation related associated with 80% of the CPI, with a minimum 2.25% over the next 3, 4, 5 years, if that is the case. And again, the first proposal for you is to extend the transfer station contract for 3 years with an option of extended one time for an additional 2 years.
Yeah.
I'll move to approve amendment number 4 to the transfer station development and services agreement between Thurston County and Regional Disposal Company, extending the term of the agreement to April 30, 2023, and authorize the Director of Public Works to execute the amendment.
Should be a second, and then we can open it up for discussion. We can do that.
Okay, I'll second it for discussion purposes.
Okay, so it's been moved and seconded to approve, amendment number 4 to the transfer station development and service contract or agreement between Thurston County and Regional Disposal Company. Any discussion?
Yes.
Yes. Okay.
I'm curious, I'll just ask the county manager here, this is a draft, is this something we're voting on?
No,
Okay.
no, this is the amendment.
I just don't see it in our packet here.
Oh, I'm sorry, I provided that last week, but I can certainly give you copies. This amendment number 4 is to the existing agreement, so that's a little bit different what you have
Okay, so
with you.
it's not about flow control?
No, the flow control is coming up.
That's coming up?
Yeah.
Okay.
So, and I think you made the question, they had the same question last year, whether the flow control ordinance that you may be considering later on has a relationship to this extension of the contract,
Yeah.
and it doesn't.
Okay.
It does not.
And this is the one that the Public Works Director has been negotiating with parties, and I guess my question is.
And Jennifer is online, if she.
It didn't have as much explanation in it, I guess, as I was hoping. When it refers to which group, who are we coordinating this with? We're just an unknown group yet to be determined, or is there a named organization in there? I'm sorry, I don't have that information in front of me. Yeah.
So the extension is with Regional Disposal Company, which is part of the Allied Waste Industries. So Allied Waste Industries, Republic, all that is part. The only contract that we have is with this outfit, the 2 contracts.
And the name of that outfit is?
Yeah.
Is what?
Yeah, that's what is the Regional Disposal Company.
And that is their name?
That's their name.
I thought you were referring to regional companies.
No. That's the actual name, which is a subsidiary of the Allied Waste Industries.
Okay,
The larger.
that's the clarification that I need. Thank you.
But we needed to have that as part of the motion, be specific, because those are the ones who signed the amendment.
Okay.
Any further?
No.
Anything?
Just thank our Public Works Director for getting this done. I know it was not easy to do.
Yes, thank you very much. I feel, like I said, last meeting, it was extremely helpful that the board gave some flexibility for the term for negotiating purposes. So I thank the board for that.
Good. Thank you, Jennifer. Okay, it's been moved and seconded and discussed. All in favor, say aye.
Aye.
Aye. Motion carries. Number 7.
So the next item is amendment number 3, but this is related to transportation and final disposal. It's with the same company. And it has the same terms, extends the existing contract for transportation and final disposal for the next 3 years. With an option of one-time extension for an additional 2 years for a potential total of 5 years. Also has a baseline starting rate for the transportation and the disposal including escalation for the next few years at 80% of the CPI with a minimum of 2.25%.
And I have the same question, is that flow control?
No, it's not. So maybe the flow control ordinance that you may be considering is stating or directing that whatever refuse is collected in the unincorporated of the county needs to be taken to the waste and the recovery center. That's the flow control ordinance you might be.
Is that the one from the working draft from 5 February 2020?
Right, but that is coming up. It's not ready for you to take an action on that.
Oh, okay, good. Thank you.
I move to approve amendment number 3 to the waste export and disposal agreement between Thurston County and Regional Disposal Company, extending the term of the agreement to April 30, 2023, and authorize the Director of Public Works to execute the amendment.
Second.
It's been moved and seconded to approve the amendment number 3 to the waste export and disposal agreement between Thurston County and Regional Disposal Company. Any further discussion?
No.
No. All in favor, say aye.
Aye.
Aye. Motion carries. That takes care of that type of business and work. And now we're moving into the commissioner items. And the first one is economic development update.
Yes, I believe we have Jenica on with us today.
Been here all day.
Yeah, and I think it was timely for Jenica to give an update. There has been a lot of activity between the EDC, the chambers, as well as the BCB. And I think everybody is starting to think about how the recovery, if there is a recovery in terms of the economic development from, will be particularly related to small businesses. As you know, small businesses are continue to struggle, as we know, and at this point we don't know the magnitude of those struggles. And I know the federal government has provided somewhat of a lifeline to some of those businesses. And whether that is going to be enough is yet to be seen, depending on how long this emergency will last. And I thought it was just probably timely to have Jenica give you a perspective overall, some of the activities that this group has started to having a conversation on. And again, Jenica has been a participant from the beginning on this particular effort.
Hi, are you able to hear me all right?
Yep.
Yes.
Yes, ma'am.
All right. Well, good afternoon, Jenica Machado, Economic Development Manager. Thank you for this time. I have a few items to update on you on for our local economic response. A few of the local conditions are being evaluated by some of our partners. The Economic Development Council, the VCB, and the Chamber have all undertaken different efforts to collect data. The county started collecting economic injury forms, which is now being taken over by the Economic Development Council. The Thurston County Chamber has an ongoing survey out to businesses, and the VCB, Experience Olympia and Beyond, has sent out a survey to gauge impacts on the tourism and event industry. We've had a couple preliminary insights, but like Ramiro had mentioned, we're really going to get a better look at what the impact's going to be in maybe a couple months as data lags on some of our indicators. But a couple preliminary insights are that we have seen $1.7 million in lost revenue from canceled events. Lodging impacts, we have seen revenue per available room down 80%. Occupancy is down 62%. As of March 28th, we have seen 6,800 unemployment claims. Some of the local indicators that have been identified to track and measure economic impact are including sales and use tax, real estate value, unemployment rate, household income, occupancy, hotel occupancy. However, we are tracking these, and as they will take some time, as the situation continues to evolve, we will present an economic impact analysis to you as soon as possible. The county, as Ramiro had mentioned, is collaborating with partners and is included in the new Thurston Regional Economic Recovery Task Force, which has been formed in partnership with local jurisdictions like City of Olympia, Lacey, Tumwater, Yelm, tribal nations, the Thurston EDC, Port of Olympia, Thurston County Chamber, the VCB, Pac Mountain, and some financial institutions. The task force members represent the major entities that were involved in the creation of the Thurston Economic Alliance. Jason Robertson from J. Rowe and Company has been retained to serve as the task force coordinator. The mission of the task force is to ensure that the economy of our region and the businesses and individuals who contribute to it and rely on it recover from the impacts of COVID-19 crisis, emerge stronger, more resilient, and positioned to thrive. Sorry, are you asking a question, Commissioner Hutchings?
No, I'm just finishing. I'm sorry.
Okay.
Taking it over the stress.
The
Well, we need
effort
to have
of
the blue
this
hand
recovery
in there.
task force is really built on 3 separate pillars. One pillar is going to be the economic stimulus to buttress and support our businesses, looking at what are some of our target industries in Thurston County. Another, technical assistance, support, and market development to enable businesses to survive. And then the third being obtaining the assets and resources for recovery and growth. Some specific activities are already underway. The creation and operation of a central information site for impacted businesses and workers is up and running, which is thurstonstrong.org. And the EDC has created a business hotline, and they're fielding roughly 150 calls a day, spending about 30 minutes per call with different businesses to help identify and connect appropriate resources that fit their specific situation. They're also doing direct business counseling, offering one-on-one sessions, and facilitating an ongoing small business grant from the city of Lacey, which has already released $500,000 in their first phase of funds. The Thurston County Chamber is providing proactive and enhanced business outreach and education. They've partnered with the EDC to host a weekly virtual talk show where they have business leaders share information, resources, and steps to recovery for small business owners. The VCB is also conducting outreach and support services for lodging and entertainment and visitor-dependent operations. They've developed a digital business engagement opportunities and promoting continuing operations like takeout, delivery services, also private office spaces being held in hotels. And they'll continue to collect and report metrics for the task force. So really with these different efforts, we're seeing that a focal point is being placed on identifying financial resources and assisting businesses and workers in accessing the resources that are available. Additionally, a top priority is to continue coordinating with federal and state agencies to ensure that the region is positioned and able to receive all appropriate recovery resources and assistance. At the moment, we're looking into funds from the CARE Act, such as the Economic Development Agency funds, the Community Development Block Grant, and we believe that remaining funds that are allocated to local governments with populations that exceed 500,000, if they have remaining funds, they'll revert back to the state. And so we're looking to see if there's an opportunity to advocate for those funds. And so there are multiple different organizations collaborating on our economic response, but we do have a process set in place already for a flow of receiving potential economic development funds for COVID-19 from the CARES Act. That goes federal, state, county. We have designated an associate development organization, which is the Thurston Economic Development Council, as our ADO. And so they're really going to help be that pipeline to access the federal and state funds. And so basically the impacts and potential relief measures are going to be evolving at a rapid pace, and I'll continue to provide updates. We are going to need commissioner support and are working to push actions to you very shortly.
Wow.
That's what I have right now. Are there any questions?
Questions?
No, sir.
Comments? Questions?
Jennifer, you mentioned Community Development Block Grant Fund.
CDBG.
Yeah, this ties to a commissioner item I have, but since you brought it up, I'll just throw it out that one of the South County mayors was asking or had the impression that there was going to be additional money from the federal government through this program this year, and then how that would work with our rotational thing that we do with our typical amount, but if there's additional monies that are, then, that's not a question for you, but I guess my question for you is, are you aware of additional monies coming through the CDBG program this year, and what's the extent of that?
Yes.
Yeah, so we do believe that money was earmarked for the CDBG grant in the CARES Act. We've been following up on a continuous basis to understand what the details are under those, but right now that's not available. I've been in contact with Thomas Webster to understand what the new process will be for determining how the COVID-19 funds will be distributed and what that process looks like.
Well, regarding that, this 700,000, I think this year goes to, this go around, goes to Lacey. So it's a good question. If there's additional money coming, what would we do with that? Robin, you had your hand up?
Yeah, I was just going to say that the county grant manager, Joe Wolf, has been assigned the analysis of the entire CARE Act, and we'll know soon if there's any additional funding available from that particular source. So we'll work with you, Jenica, on what you're finding.
I just got an email from Dallas Roberts and related to the additional CDBG money, and he states that perhaps, Dallas Roberts represents the office of Congressman Denny Heck, just for the public's information. And he expects the county will be awarded close to $700,000. We need to look whether that is, in fact, a direct allocation, and how that really relates, because it has to be related to COVID-19 impacts.
Yeah.
So I don't believe there is going to be an opportunity for us to take additional CDBG money and just distribute it on a normal process. I believe we need to find, and Joe Wolf is going to go through the process, determine what are the strings attached related to the additional CDBG dollars as part of the funding.
Right. That's one of the things that the fiscal response team is working on.
Okay. Did that answer your question?
I think so. Yeah, more to come. I mean, it doesn't answer it yet, but it answers it that we're on top of it, and we'll discuss it once we know the details.
Address good. Anything? Jenica, I have one question. You say there's an economic impact report coming out soon. What you just kind of gave an abridged version of, is that in print? The 80%, the 1.7 million lost revenue, is that available?
I received some preliminary slides from Jason Robertson with those data points. And so I can see what all I can send over to you if you'd like to see that. I think that with the economic analysis, it may be a couple months before we see that, just as the situation continues to evolve. If we could it'd be hard to take a snapshot now and have it be accurate for the bigger picture. And so we'll continue to release insights as we have them, but a complete economic analysis might be a couple months down the road.
I get that. And even an update probably 6 months, a year down the road. Look at it in totality. But if you have something preliminary out that you just reported on, like the 1.7 million loss in just cancellations and bookings, that's information I can still talk about currently. When people say, oh, the economy's bad. Well, yeah, here's how bad it is, folks. 80% reduction with that in bed rentals and occupancy. We can document that now. Can you get that?
Yeah, I can send that over to you.
Yeah, that'd be very helpful. I appreciate that. Thank you. Not spreading gloom and doom, but letting people know this is the reality we're facing. We're in it right now. And it could get worse. It could stay the same, get better, but prepare. Thank you. Anything else?
No, sir.
Jenica?
Jason Robertson did some great work for Intercity Transit, so good choice, whoever made that choice. I think we'll be happy with the work.
Good job. Thank you, Jenica.
Thank you.
You're free to roam about the building. We already discussed the number 2. I was going to say it. Number 3, economic declaration ordinance.
Yeah, the board issue an emergency ordinance. There's going to be lapsing in the next week or so. So Elizabeth and I are going to be working on, for you to consider extending that emergency declaration until at least mid-May. So this is just to give you a heads up that we're working on this ordinance, just to give you indication that in fact, the initial ordinance has time limited. So we're going to make sure that you consider taking an action on a timely matter.
And when will that take place?
I
When are you?
will bring this ordinance for your consideration next Tuesday.
Next Tuesday, okay. For discussion, I guess, I would hope that we can have some answers to our earlier discussion on the COVID issue by then.
On the data?
On the
Yeah,
data, information that we requested.
Yeah, and in fact, I just saw the staff is going to have a meeting this afternoon just to have those conversations. Legal counsel is going to be part of that conversation, so we certainly will be prepared to give you an answer.
I'll pass it off. I had that as to close with, make sure we get that, so thank you for that. Anything on the emergency declaration?
No, sir.
We had, if I remember right, we had to do a board declaration and a Board of Health declaration. Is that also going to be necessary?
No, because the Board of Health declaration at that point is we were following what the state was doing in terms of limiting the gatherings of 250 people or more. That was the Board of Health declaration. So, but days after that, it became null and void in a way because the governor reduced that. Yeah, the governor reduced to 50 and then make it a more statewide. But it was so no need for the Board of Health to take an action on that.
Amazing, isn't he?
What's that?
Amazing, isn't he? The amount of recall and detail you keep ahead all the time. Good grief.
Yeah.
All right, thanks. So that'll be coming next week.
The emergency declaration, nothing from the Board of Health perspective that I'm tracking.
Okay. Trailhead closures.
Yes. This an item the Commissioner Menser asked to include it on the discussion. You know, as you know, we close all county facilities, including parks, including trailheads. But we cannot close the trail. I mean, that's impossible to go through and close every single road that access the trail, or every single access that perhaps on the back side of a neighborhood has access to the trail because they have built several connections. So, and that is something that I believe, at least from my point of view, it was understandable that the closing the trail itself is going to be extremely tasking. But we did close the trailheads and access, meaning parking. And in a couple of occasions, we do have a couple of bathrooms that we have closed as well. So as a user of the trail, you know, I have seen individuals, the amount of people that I usually see on the trail is greatly reduced. No doubt in my mind. But also the individuals who have used the trail, from my observation, my personal observation, they're very cognizant about exercise and social distancing. And sometimes they take, you know, a larger distance. They trail one another. I don't see, at least from what I have seen, I don't see any groups of runners or any big groups of bicyclists. If there's anybody that I see walking together, is perhaps maybe my assumption, husband and wife, somebody who can probably live on the same borders. But I believe it was a request to open some of the, if not all, the trailheads. I have Jennifer on this, and the staff had the opportunity to provide some feedback. I don't want to steal the thunder of Commissioner Menser's item, nor Jennifer. So this is the framing of this item. Commissioner Menser would like to.
Go ahead,
A citizen brought this to my attention, but I know as a father, I've got 2 kids at home, and they've been home now for 4 weeks, and they've got about 10 weeks ahead of them at least. And the only thing that we can do besides they can't even play with their friends across the street. So the only thing that we can do besides board games and stuff is to go on a walk or a bike on a trail. And so for people's mental health and physical health, I think it's critical that we have access to these trails to the extent possible. There's certain ones that have been closed. I mean, the trail closures because of state parks and other things. I mean, I 4 or 5 of the places I was gonna go this weekend, I went on the internet, I can't go there, they're closed. But we do have a few trails that remain open. And I think that the access to those trails needs to remain open so that citizens have something to do for their sanity. I really think we're gonna see domestic violence increase. We're gonna see child abuse claims increase. I mean, this is an unprecedented situation, and I can tell you how the governor's school extension order went over like a lead balloon in my house yesterday with a public school teacher and 2 middle schoolers just raring to get outside to do something. So I think we have an obligation to do anything we can to keep access to those trails. It's pretty much the lifeline of community health at this point.
I'm glad to hear you say that.
Okay, I'm gonna be a second vote on your proposal. So, but
You give
beyond
Jennifer.
that, I think that it is stupid that we've closed the county parks along with it. Now, we might hear from Public Works that there maybe was some reasoning, but I just don't see, I mean, you can't take your kid fishing now during this period of time? Who's gonna be in the boat? Some stranger or to go out on a dock? I mean, everybody is very conscious of social distancing, maintaining that separation at all levels. I think it was ill thought out to close our parks in the first place. I think it was ill thought out to close our state access to recreational activities. So I'd like to go a step farther and open up our parks as well. So, and to what extent, I guess I want to open them up all the way, but I guess I'm willing to listen to staff as far as maybe why not, but I don't know that I'll agree with it.
Hold on, Jennifer.
Without knowing what they said, you wouldn't agree.
I just wanted, no, I'm just not going to say I'm going to.
That was a nice segue, so they have behind the 8 ball and providing comments to you.
Maybe so, maybe so.
Since the Commissioner bridged to the park issue, I probably should know the answer because I sit at the Friday 3 Cities meeting, but I don't recall what the different cities are doing with their different parks. My recollection is they're all doing something a little different.
Yeah, they
like cordoning off the playground areas, but allowing the grassy areas or something like that.
Yeah, they have different strategies. For the most part, they have closed the parks, as far as I understand. I think there is some instances in the bathrooms have been open, and depending on the location, downtown Olympia.
3 in Olympia.
They just opened the bathrooms, but for the most part, I believe the parks have been closing.
Well, can I ask about that on the bathrooms? Isn't that the same ones that we were told they were locking up initially? Initially, they locked the bathrooms.
Yes, but they opened it up.
Finally decided that was stupid, right?
Well, don't drag me to that conversation, Commissioner.
I know, I'm just saying, we often do knee-jerk reactions to things. Can you imagine the Falls Park up at the Deschutes River that we opened up some time back, and why that's not open for citizens to go up there? That's nuts. This is designed for people, I guess, in the ghetto that don't have a car to go anywhere. I don't know why it was designed this way, but I really think we need to reconsider it.
I'm sorry, I didn't get your last comment.
Where's the ghetto?
This was designed.
I'm sorry, what was this?
This whole thing, by closing down all parks, state fishing, state access. I don't know who came up with that idea, but I believe it was designed by people that live in a ghetto and they don't have a vehicle.
Well, I don't know about that. It was, I think, as a result of eliminating gatherings, as a result of this.
I know, but it's for the more populated areas. We've got very nice facilities out here in our community, and I agree with Commissioner Mensah 100%. people need to be able to take their family members especially and at least try to enjoy some normalcy.
So Jennifer, before we get to you, I had a conversation with a dispatcher over the weekend, and she said that people keep calling 911, asking or telling dispatch, hey, I saw a group of people that are too close together, send a sheriff deputy out, or send a local police officer out. They call 911. Do I need a card to carry in my car with me so if I'm going somewhere, if I get stopped by the police? And she said also that they get the most ridiculous phone calls at 911, and which takes up space, of course, for the emergency 911. Well, I got a call over the weekend also from someone who said, is the dog park open at the wharf? I said, I don't believe so, because people congregate with the dog park. And he went out there and he said, yep, sure enough, it's closed. And Sunday, this last Sunday, my wife and I were gonna take our 2 dogs for a walk. So we went to a park in Tumwater, and it was gated. And people were parking across the street walking in. And I had an associate or friend say they parked at a trailhead at a state, like a trailhead up in Capitol Forest. And the green suit came up and said, get the brakes, it's closed, the forest is closed. I don't know how you close a forest, but they were kicked out. And so we drove from our home to our son's home. We had to cross the Chehalis Western Trail. And I told my wife, I asked her, hey, look to the right, tell me how many people you see. I'll look to the left. And so she did. She saw 2 people way down the road. And I looked to the left. There's about 8 people together, but they look like a family. So we went to his neighborhood, my son's neighborhood, and we walked his neighborhood. But I agree in keeping the trails open. Good grief, you can't go hardly anywhere else but walk the sidewalks. But now, Jennifer, it's your turn now.
Tell us why we're wrong, Jennifer.
Well, I don't know that it's a matter of right or wrong. I think that it was a phased approach that we did. So when the county facilities were restricted to public access, we started looking at the facilities that we have. Those weren't just the buildings. And then when county government shut down for non-essential services, that was our next phased approach. And so we're looking at what responsibility that we have in terms of facilities that we have where people are not adhering to social distancing. So that's what we were looking at and why we made the decision in terms of essential services and what responsibility we had for the community. But we are open if the board is wanting to reconsider that. That is something we certainly can do. I think that the facilities, if they are an increased usage and staff are doing more out there, there's a cost associated with that.
I don't mind being a leader as the county entity, and by that I mean I went to PetSmart yesterday, got a couple items, and they asked me if I wanted a paper bag. And boy, I didn't need them. I was just carrying 2 items. And I said, no, I don't need a bag. Are you charging? Oh yeah, corporate says we're going to still charge a nickel a bag. I thought that was kind of cheesy. But anyway, the majority of places, if not all of them, have stopped. In fact, they're bagging plastic now. Plastic bag, here you go, at the supermarket. So everybody, you're right. Some people are doing it differently, the parks and such. And my thinking is, if we open up the parks, the county parks, I think that's pretty bold, and I like it because it stands out. Olympia or not Olympia, Lacey, Tumwater have shut their parks down if they have, but come to the county parks, we're open. So I love the idea, but my concern is that everybody in the urban core now is going to use our parks, and now we're going to have the crowding at the parks. It's a concern. Is it realistic? No, it might not be. It's a big park, but I agree with Commissioner Edwards. Golly, the Chutes Falls, that park, the Chutes Park is it's stunning. And why not go out there and spend some quality time refreshing your brain and your mental health, or any one of our other parks that are closed. But it merits further discussion. Anything further?
Oh, yeah, well, if you want further discussion, I say that's a piece of bureaucratic stupidity to keep, you said further discussion? I wanna move forward on opening the parks as well as the trails. Now, I don't know if I'm gonna get a second vote or not, but I'm pushing that we open the parks.
You'll get a vote. I don't think it's stupid or bureaucratic. I think it's done for the public health. I think it's done with the right intentions for people and to include kids, all people. I don't think it's stupid or bureaucratic.
Well, oftentimes common sense doesn't come into the equation.
I get that.
Well, you know, we've talked in the past about when we were looking at our park system, we talked about how the municipal parks versus the county parks and how, like, philosophically they're different, they're complementary. The city parks are more, you know, small playground, you know, just, you know, the county parks are more large space. We don't have playgrounds because people aren't walking from their house. They're usually a picnic. You know, I mean, I'm thinking of Fry Cove, Deschutes Falls, Kennydale's kind of in the middle. I mean, we only have a handful of parks, but they're different. And I think the structural difference in a county park versus a municipal park could sort of help buttress this argument that the county parks maybe ought to stay open when even if city parks are not, because it's a place to get, I mean, it's consistent with the social distancing. They're more set up to be socially distanced. I don't know of any, does Kennydale even have a playground with like jungle gym kind of thing?
We do.
Okay.
I do, yeah.
Well, maybe that, you know, stays closed. I know the cities have taken that approach, but in terms of green space and walking around, like Fry Cove has trails you can walk around, beach you can play on. There's absolutely no reason why people can't be 6 feet apart on any of those facilities. Deschutes Falls, as Commissioner Edwards points out. So you know, we all have a different take on this, but to me, it's not just reacting against, I mean, I think that I think it's arguably consistent with the overall structure and what we're trying to accomplish to keep county parks open, even where cities have made a contrary decision. So we have different kind of parks. Sorry.
So Jennifer, a question for you at the end of this. You can't get the McLean Nature Trail, which is a great place to take kids, great place. Miller Sylvania is closed, obviously, the state park. Tommy State Park, these places are shut down.
Capitol Forest.
You shut down a forest. But if we were to open our county parks, it's just like, open it up and everything's okay? You gotta rely on Commissioner Edwards' mantra. We only got 4 parks employees when everybody else has hundreds. Now, I'm not mocking you, but if we open.
But it's true.
If we open the parks, does that put a
Just
burden
repeating
on
what you said.
Does it put a burden on our staff, our park staff then? And how big of an issue is that?
Well, we won't know until it happens. I would anticipate that, you know, we talked, I think we met last year and we talked about level of service. And we had, based off of funding, we had reduced our level of service in terms of how frequently we're mowing, how frequently we're cleaning, picking up trash, that type of thing, visiting the facilities. I anticipate that the use of those parks will increase substantially. And that would require us to frequent them more often. So, yeah, I anticipate that happening. I anticipate the cost of maintaining them to increase. It's something that certainly we can do. I mean, we'll plan for, but there's a cost associated with that, and we know it's general fund money. I also know that, I guess I'm interested in the board's perspective regarding having what responsibility, if any, you see the department or staff having if people that are frequenting the parks and trails are not adhering to the governor's order and CDC guidelines regarding social distancing.
Are our parks employees staying home? Have they been repurposed? Are they looking for work?
They're not looking for work. They,
They can repurpose.
yeah, they're not looking for work.
Okay, I would love nothing more than, especially with the emotional stress that people are under, get out of your house. The weather this week is gonna be stunning. Yeah, that's where I'm at.
Jennifer, this conversation has gone to the parks, and I'm almost there, but my original question was just, if we just, and I don't know how many different trailheads or parking access areas
2 or 3.
consider, comparable to the one that I got the email about that I think Ramiro forwarded. How much of, if we just did that and didn't worry about the parks in general, would that be an additional burden, or do you see problems with just opening up all of our trailhead access points that are within our control?
No, we can do that. Are you wanting the bathroom facilities opened as well?
Not necessarily. Well,
I do.
Yeah.
yeah, I mean, the citizen who asked was just saying, I understand why your bathrooms are closed, but we should be able to access the trails. But, you know, that's another point of consideration. So I don't know the answer to that, but I just wanted to make sure that, I wanted to know if the request was limited, to what the particular citizen brought up, what would that mean in terms of this larger discussion about level of service and staffing concerns and additional expense and enforcement? Sounds like it would be a pretty straightforward thing to do.
To open up the trailheads?
To open up all the trail access points.
That would be, if we're talking about facilities, if we're talking about restrooms, yeah, I anticipate that we will have to frequent them more often.
Yeah.
If we open those
So
up.
they increase.
They would be an attraction, and I don't have a problem with that. Yes, sir.
I don't have a problem with it either. I think that what we do here, we should consider the community's wellness. We're talking about wellness, I guess, from a virus perspective. But let's think about, you brought up mental wellness. It's all part of wellness. So let's address that. And when it comes to the liability, I mean, the jungle gym might be blocked off or something because hands are gonna be touching it and all that. I mean, I think that it's up to the parents when they go there to have a certain amount of responsibility on their shoulders, if you will. It's just like a kid could pick up pre-chewed gum and eat it in a park. Does that mean we can't allow them to go to the park, you know?
Well, it's just like the grocery carts.
Yeah, the grocery carts, it's everything. So it's up to the parent to make a decision on if they want the kid to play or not, wash their hands, whatever it might be. I'm willing to step out and try to accommodate the public's desires. And I'm sure the public is, well, I guess I'm not sure, but I think the public's with us.
When you talk about public health, I have been saying consistently that includes the mental health of our community.
Sure.
The overall well-being of our community. And we have thousands of kids in lockdown. They need to get out and run and scream and play and tumble and roll. And I'm in favor of not locking them into the house, at least giving them an option. Romero?
And it's just my perspective. Whether you like to hear it or not, here it goes. I believe the open the trailheads is a good first step because the trail itself is a linear facility. It's not a one stop, and you can potentially have people to congregate. And I do believe in the responsibility the citizens have, but not all citizens follow the social distancing as we will wish. And in fact, you send a letter to the editor emphasizing the social distancing and the responsibility all of us have to follow that. And also, I believe that you may consider also be part of the solution, the larger solution as to what we need to do in order to practice social distancing, because that's one the best possible tool that we have to deal with this adversity. But I do believe the trail system provides the opportunity for social distancing. It's linear, it's fluid, it's not a point of congregation. If I may. So that's my perspective.
So think about the dog park for a minute while I ask Brian. What you say is true. If we were to open up the parks again, we're not saying we don't care about social distancing anymore either. They still have to practice those things. So I'm turning to our PIO. When do those PSAs come out on radio?
So we'll be publishing the webpage later today and sending it out to the radio stations. So they could run as early as this afternoon.
Yeah, that's the same with, do you have any idea when Olympia and they're doing theirs as well?
We already have theirs. We're hosting them all on the same webpage.
We are, okay. So if we're posting that message out, at least on the radio, whatever stations we're hitting, and on our website?
Yeah. So,
in various places?
Mm-hmm. Yeah, so we'll be sharing, so they'll be on the webpage, radio stations can pull them from there. And then I think on Friday is when we'll start sharing them on social media, but we want to give a chance for the radio stations to get to start playing them before we broadcast them broadly.
Because we're not suggesting, hey, let's extend permitting to the time period to September 20, because we don't care about social distancing. We're not setting policy because we don't care. I agree, we want to reemphasize that message if we open up our parks. I understand that concept too of linear versus a circular gathering place. Jennifer, you have any more?
Commissioner, this is Shelley, and Dr. Yu has some words she would like to share with you.
Okay then. Go ahead, Doctor.
Hi, good morning.
Good morning.
Good morning. I think, I am definitely a proponent for good mental health and getting fresh air. I think I have a few concerns, and one is the having 3 parks open and encouraging people to come out would be a concern. I think, people are looking for places to go, and I think having it open may be okay. And in the trails, sometimes it's hard unless you have a one-way system for people to avoid. Most of the trails are pretty narrow. But also, if you have 1,000 kids show up at the park, you have to have some way to limit the entry so that you are able, even though the parks are big, if everybody ends up wanting to go out there, there needs to be a way to limit the entry, just like we do now at the grocery stores. They're not allowing everybody to come in at the same time. So that you can practice social distancing. And then I think the only other thing I thought of was the staffing. The staff at Thurston County that's going to need to maintain and clean. It would be an increased risk to them. But if we have adequate staffing, then that's good. I mean, we have to have the facilities open so that people can wash their hands. Thank you.
That's good information, Doctor. Thank you. Go ahead, Ty.
So when Ramiro, you said you're used to the trails, and now there's not as many people on the trails. Even though the governor said, go out and use the trails. Right. So I guess I'm challenging this notion that there's going to be a million people at the county parks. First of all, most people don't know where the county parks are. They don't, if they're not using the trails, Ingrid, I think a lot of people are just scared to go out, period. And if that theory were true, why aren't there a million people on the trail? Why aren't there more people on the trails? You're saying there's less people on the trails. Why would I believe that there's going to be more people at Fry Cove Park than there would be normally? So I don't agree with the surge theory that it's going to be a surge. So I guess that's one point. I mean, I guess I do understand the fact that the trails that we're talking about, all the narrow trails when you are closed. So the trails that we're talking about are quite wide and they're paved. I mean,
12 feet.
These are not hiking trails where you have to step off the side of the trail. And I don't know any trail like that we can even go on. I understand that trails by their nature involve motion. You don't just go onto a trail and stand there and do something. So there is a value to that. If we limited it to the trails, you'd have people in motion less likely to congregate. That argument makes sense to me. But the idea that we're going to have great congregations to Fry Cove or Deschutes Falls in contravention of our health officers' directives and our governor's directives, I mean, just because we've opened the county parks. I don't know, I'm just not sure that that's true.
We have several people in this community, worldwide, that use false logic. For example, we open up the parks today, county opens up its parks, and there is a surge, and I'm concerned there's gonna be a surge. They're gonna say, see, there's a surge because you opened up your parks. Just food for thought, people will make that causal link, but I don't agree with it, obviously.
Would it be worth, as a test, opening up the Chutes Park? That's the farthest one away, you know, and maybe for close in Fry Cove or something. And see if that works. And then maybe, I don't know, think about it next week. I think, are we all there on the opening up the trailheads and the trails? Are we there?
Yeah.
Yeah.
What do we need to do that make that happen?
You just did.
Okay, we're all there. Okay, so we're all there on that. Is there an interest in trying a test, an experiment on a couple of locations, just to see?
Fried Cove and Chutes Falls, they're on opposite ends of the county,
Let people take a run.
both in rural locations.
Let's see how it works. I would go for that.
However,
Yeah, go ahead.
I'm looking at transportation issues for some folks that they can't go to the Netherlands to get to,
They're gonna have to walk.
maybe somewhere in between to help with people that have transportation issues.
It might as well open all the parks.
They might as well open all of them, that's my argument.
I strongly encourage you to pace yourself, commissioners, because I do believe that you have an obligation to be part of the solution. And whether they materializes the surge or not, but it's just opening the parks because it's an invitation for people to come and congregate. Whether it materializes or not, I'm not in the position to tell you whether that will be the case or not. I'm just
Have the cities
concerned.
closed their parks, all of them? Has Olympia, Tomar, and Lacey completely closed access to all parks?
Yep.
I think
And that's what the state of Washington has closed all their parks and the boat launches and everything.
The state of Washington has closed their park system and trails.
However, I think, weren't some of Olympia parks open and they just roped off the playgrounds? I can't imagine Priest Point Park being closed because it's so full of trails where you can distance yourself and go down to the water and still not get the playground. But aren't some of Olympia's open, you know, Jennifer, with just the playground roped off?
I couldn't give you specifics. I'd have to.
Sure. Okay. Wait, did you have more to say?
The only other comment I would make is that, we'll follow the direction of the board, absolutely, and make it work. What I won't be able to do is do a controlled limiting access at the entry points for the
That would be impossible.
Doctor you talked about. I will not be able to do that.
Okay, great, Gary.
I don't know, I'm all for opening the trails. I'm actually inclined to open the parks myself, but I'm always out there taking a chance, it seems like. Do you wanna take and get a review by staff, so Jennifer could have somebody check in? Is the park you just referred to, is it open, is it not? Seems like we have a lot of unknown on what is being allowed and what's not, and then maybe by next Tuesday, we could have a report back that, yeah, Lacey's doing this. Or,
Well, there's always going to be, although the parks are closed, Priest Point Park, the gate is closed, there's always going to be people who goes around the
yeah,
gate.
what are we gonna do? We're
And
gonna
use
start
it. I mean,
arresting them?
and the same is occurring, I would assume, in county parks. The question is whether you, as a Board of County Commissioners, want to open all county parks, encouraging gatherings. And that's what probably, at least from my point of view, I'd recommend for you to be mindful about that.
And it's kind of funny that in speaking with the mayors last week, and they say, don't give your uniform personnel. They didn't say don't give it to them. They said, you're giving your uniform personnel 5% hazard pay. That's putting pressure on us because they're not doing it. And if we were to open our parks, they would say, thank you. Our people have a place to go. Or they may say, now you're putting pressure on us to open our city parks now. I don't have any idea, but it has to be mindful. We must be mindful of what we do not only for the people, but for our staff as well, in logistics. We can't monitor the entrance and, monitor occupancy at the park. It's a county park. They're huge. But I'm still leaning that way from opening the parks. Trailheads, yes. Did you have something else?
I just want to make the point that, the governor's, one of the frustrating pieces of the governor's order was that it specifically said, go out and enjoy nature, stay close to home. They don't want you driving to Olympic National Park or around Rainier, but stay close to home, but enjoy nature, enjoy trails. But then they're all closed. And it's kind of like, and I just, if it's a social distancing issue, we are relying, the social distancing, we are relying on the community to do this. I could send my kids down the street to go play with their friends. And I, as a responsible parent, I'm not doing that. People can get together in the neighborhood and have a party, and they're not doing that. To say that I can't go walk on a trail, and somehow that's gonna stop, if I'm not gonna honor social distancing, then there's 1,000 ways I could violate it besides going on a trail or going to a park and walking around. So I'm a little bit disconnected in seeing how that is somehow necessary to affect the flattening the curve and social distancing. It's really on each of us to take that responsibility. And when I'm on the trail, I move to the side. We stay away from people. And that's what we do. Just like I do if I have to go to Hagen or Safeway. Just like I do if I'm around this office because I'm an essential worker and I have to be at meetings. That's my responsibility as a citizen, and I'll take that seriously. Telling me I can't go to Fry Cove and walk around on the beach, which is my neighborhood park, it's just creating more problems than it's solving by keeping people cooped up.
Yes, sir.
We've got about 300,000 people in Thurston County, and we're driving them nuts basically by not allowing some type of recreation. And we're doing this, and we've got, over the last month, we've got, 67 individuals that have come down to that. I mean, I don't know what the percentage is of that. And I realize that it can be passed on expeditiously as it goes on, but I really think we're penalizing a heck of a lot of people for a very small number of people and that are having a problem, and it's a serious problem. But maybe we could have Santa cans deposited or something brought there by some outfit, and that would take care of that. As far as the hand washing business, I mean, dang, the parents have to have some responsibility of having hand sanitizer with them. I will say, one of the things I have enjoyed since this whole thing has happened, when I am in a restroom and I turn on the hot water, it's actually warm. Most places, the hot water tank must be 100 yards away because it's cold all the time.
That's the silver lining.
Yeah, there's a silver lining there. So I don't think we can be everything for everybody and protect everyone from everything. So I'm inclined to move forward. Let's open a couple parks and see, maybe we can do temporary parks employees. If somebody's recovered from this thing already, wants to go out there, we could have them park rangers or something. So, I mean, it looks like we're at the trails. We've already agreed, we're good with the trails. I want to take one step farther and go to the 2 parks as designated by Commissioner Minzer.
And I'm gonna hang my hat on what Dr. Yu said, and that is mental health and wellness is paramount as well. I didn't say paramount, but very important for the community. And I also agree, it's not our job to police every single citizen in the county. There is a great deal of responsibility that they bear in maintaining the social distance and taking care of their people in their care and their charge. And we are flexible. I'm inclined to open up all of our county parks.
Commissioner, does that include the dog park at the Wake Recovery Center?
That, I would say, is more problematic because the work is closed at least for another couple days, 2 days or so. And that is a confined, fenced-in spot where people want to go and hang out with the dogs, and I think that's more enclosed and maybe more problematic. Are dogs allowed in parks if they're under control and on leash? In our county parks?
I believe they have to be on leash.
They have to be on leash, but they can go out in our county parks. I don't think they can in the city, but again, that's a city. I don't know if they allow that and which ones they allow the dogs. But they're not gonna run loose. I would say no to the dog park, but that's just me, because they can take the dogs elsewhere.
I think the reason we closed it down is because at one point we had 25 people standing and sitting around the picnic table.
I can see the dog park being problematic. If we can take a dog on a trail and we can put them in the county park so people can walk the dogs, I'm okay with that. So, do you have another comment?
I'm gonna try to wrap this up by moving to do the 2 parks that we identified. Couple weeks, we'll see how it goes. If it's not going well by some report, we can scale it back. Say, well, we tried, and if it's going well, we can open them all, but I don't know. Deschutes Falls and Fry Cove, and all trailhead access points.
Are you tied to those 2 parks, or if we wanted to propose, I don't have something to propose just right now. But the only reason I ask is because they're spread out so far, and so when we have staff, I mean, the amount of time it takes to get there, it's just increasing.
I was just thinking about trying to minimize driving so South County folks would have a place and North County folks would have a place.
Okay.
But yeah, I mean, if you want to make a counter, I'm not tied to those 2.
I want you to make a counter because I want to open up all the parks. And if we do Fry Cove and Deschutes Falls, if there's one kind of centralized we can open up, I'll be okay with that.
I'm sorry, Commissioner, can you say that one more time? I apologize.
If we open up the far 2 extended parks, Fry Cove and Deschutes Falls, that's a good thing. But I want all parks open, but short of all parks, if we had one that was somewhat centralized, then I would be okay with that. I want all parks open. I'm not gonna get that, it sounds like. But if you proffered a 3rd park that we could give the center population access to, I'd be happy.
Okay, so okay. I think what I'm hearing you say, are you proposing 3 parks or a center park?
Just 3. 3.
What else do we have besides Kennydale and am I forgetting? I know we have 4 or 5.
Burfoot.
Burfoot. Oh, Burfoot, right.
That's a little more difficult because there is a trail, very narrow trail going to the beach.
What other parks do we have?
Oh, goodness.
Really gonna put her on the
I'm
spot.
scratching my head, I can't think of it.
Carrie's not there, so.
Or you can come up with you can give it to us later. But today we're opening up all trails,
All the trailheads.
all the trailheads.
The trails are open.
They're open, yeah. People are using it.
Yeah.
Do we want to have more discussion? Is that what we're?
Jennifer might offer another park that,
We can discuss parks next week is okay with me.
we can do that, we have to take
My
more
goal
time.
was to get the trailheads open, so I appreciate your indulgence on that.
If you get back to us on that, Jennifer, don't do it now.
Okay.
All trailheads are open. And you can open up the 2 extended ones, north and south.
So we already have
Well,
porta
what I'm hearing is the trailheads, the board decided to open.
Yes.
And opening the parks, we'd like to bring next week for further discussion.
Yeah,
Okay, then.
sounds like it.
Thank you.
But when we come with that further discussion, could we come with some knowledge of other jurisdictional activity?
Yes.
Anything else for Jennifer?
No, that works for me. Thank you.
Thank you, Jennifer, appreciate it.
Thanks.
And so, we're moving on to,
I thought it was going to be a short item. There you go.
oh, good grief. Moving on to public testimony, I just want to,
No, I have number 5, Commissioner Robin. Is this going to be brief?
public testimony?
Number 5, which is
Item
gambling.
number 5, public testimony.
Oh, I'm sorry. Is an item today, sorry. There is a gambling return extension request. There is a request to extend getting gambling revenues to the county. So, Robin?
Okay.
Yes, good morning or good afternoon. So we received
about the
a
agenda.
request Am I on mute?
No, you're
we
fine.
got you.
Okay. So, Jeff Gadman received a request from the National Entertainment Network. They apparently own and operate amusement machines that include gambling machines at our bars and restaurants. And what they have asked is to have an extension to submit their first quarter taxes. We collect $72,000 in 2019 for gambling taxes. So far this year, we've collected $19,000. I would recommend that we honor this extension in alignment with the state's extension on submitting sales taxes. And the little bit of money that we would be waiting for is not the thing that's going to break us. I would also just let you know that Thurston County Codes assigns administrative duties for this to the treasurer. So the treasurer is looking for your input, but ultimately he was authorized to make the final decision.
What kind of a delay are we looking at? 60 days?
I would delay it 1 quarter.
A quarter? Okay.
Yeah.
Okay.
Okay.
3 thumbs up.
What Jeff says.
All right. Thank you.
Please exercise your vote for the,
Yeah, 3 thumbs up, unanimous.
Thank you.
You're welcome. Do you have another item?
no, sir.
The one under public comment, a citizen submitted a letter regarding the docket, and I just want to advise that citizen it'll be placed in the file, so it's part of public record.
Yeah, and we'll look into the details of that. We'll be prepared to answer those questions next week when you review the docket.
Okay. This meeting was over at 12, I'm not shutting it down yet. It was over, we're 18 minutes over, 19 minutes over, go ahead.
As we open the park trails, because that's part of our parks, could we put up some signs that just remember social distancing? Maybe it'd be pretty simple.
Maybe that will be some of the strategies when you revisit this item next week.
Okay.
And will there be a press release going out then?
You would like? We can do
I
that.
would.
About the trails,
Trailheads are open.
trailheads.
I want people, that's a breath of fresh air, no pun intended. I think it's great. Let's get some media on that.
Okay.
Thank
Put
you.
that together.
Besides that, Ty and I don't get to agree very often.
Yeah. Yeah. Also, as we are in this, as a community, we're surfing, like I said before, surfing the edge of chaos. Your county government, your local government is not in chaos. And we're still functioning and moving right along, keeping current and being as transparent as we can. Thank you all for watching, and we are now done. Oh, county manager, please.
And I'm gonna sound like a broken record, commissioners, but I think we need to lead by example. You can still conduct county business remotely. So I will encourage you, particularly the 2 of you, to consider that option.
These 2? They're not supposed to point anybody out apparently.
Yeah, that might be, yeah, that's a HIPAA violation, and I'm
No,
gonna be
sir.
filing a lawsuit.
No, sir, this is all out in the
All
open.
right, thank you.
So.
Thank you for watching. We'll see you next time.